So when you're done, Som, at the end of this, if I'm not online, just
End the meeting.
Yeah, just end meeting for all.
Yeah, because we shouldn't really have questions because it's more of an interactive clinic session today anyway. So
Yeah.
we'll go as well. Yeah, perfect. Okay.
So you have Claire in the room, Deborah, Francis, Francesca, Josie, Mary. Oh, that moved around. Marina.
How do I find out who's in the room?
Sarah. Look at this on the side, on the right hand side. You'll have
See, if I'm screen sharing, I don't get to see much, do I? No.
when if you look at the bottom of your screen, you should be able to find your panelists will be there.
Participants.
I'm just going to let everybody allow talk. So
yeah, that'd be better because I think last time a couple of them couldn't speak, especially Randy Raj, and she's doing a case today.
Well, so if they drop off or if they join late, sometimes it becomes an issue.
Right, okay. So attendees 12.
Hi, everybody. Just so you know, you're all unmuted. Well, I've given you all permission to talk. So if you could all just mute your mics unless you're talking.
Hi, Tanya. Morning. Hi, Som. Morning. It's Francesca
Morning,
here.
everybody.
Hi, Francesca.
Good
morning.
Morning, everybody. Somebody's got their hands up. Marina is
Mariana.
Mariana, are you just saying hi?
Yeah, hello.
Hello. There we go.
Nice to be back.
Welcome back, Mariana.
Thank you, Sam. Looking forward to this one.
Good. We got 3 interesting cases. We thought we were going to have 4, but we've got 3. It should be quite interesting, actually. I'm hoping for a very interactive discussion amongst everybody today.
So everybody should be unmuted. If you aren't unmuted, everybody should have permission to talk. If you don't have permission to talk or you can't talk, there is a raise your hand icon. If you just hit that, then I can find you. But from what I can see, everybody should have the ability to talk. Maybe if we all just have a test and say good morning.
Morning. Good morning, Francis here.
Morning, Francis.
Good morning.
Morning.
I was going to say, with so few of us, is it worth just doing a quick roll call down the list of attendees?
Yeah, fine. So, Claire.
Yes, good morning. Hello.
Oh, there's 2 Claires.
Yeah. Oh. Claire K.
Okay, and then Claire. Who's the other Claire? Claire Cooper.
Oh yeah, hi, I'm here, Claire Cooper. Morning.
Morning. Deborah Harding.
Morning.
Oh, everybody keeps jumping around. Sorry. Francis Spalding. Sorry.
Oh, yes, Spalding. Yes, that's me. Good morning.
Morning, Francis.
Hi there.
Julie Betts.
Hi, yes. I'm Julie.
Randy Raj.
Yeah, Randiraj, sorry.
Morning.
Morning.
Sarah.
Hi,
Sarah Trinnery.
Yeah, morning, that's me. Hi.
Hi. We've had Karamjeet call pop up. Karamjeet, are you there?
Hi, Som.
Hi there. Morning.
Yes,
I see what you mean, Tanya. The names keep changing, don't they?
Yeah, they keep moving around as people coming in. Roger's here.
Morning, Roger. Kalyani, are you there?
Hi there, morning.
Morning. Ifsa? No response from Ifsa.
Hiya, morning.
Morning. And we have, oh gosh, we have Heidi, I think.
Yes.
Morning,
Hi,
Heidi.
morning. It's Heidi. Hi.
Morning, it's Amanda.
Morning, Amanda.
I think everybody should have the ability to talk now.
Yeah. We've got Noreen there. Hi, Noreen. Hi, Fula.
Morning. Hi.
Hi. I think we have Josie as well. Either that's Josie or she sounds about 3 years old, but there you go. That's probably our youngest student ever. But there you go.
No, amazing. Get them in there while they're young.
Right,
Right.
okay.
I do just for those who joined in a little bit later, you have all got the ability to talk and unmute yourselves. So if we can just ask everybody to mute themselves if they're not talking, and then just unmute yourself when you're talking. Otherwise, there's actually 19 people on this, and if we all have our mics unmuted, it'll be quite difficult for people to hear everybody. So yes, I think everybody's here, Som.
Okay. Right. Let me know, Tanya, if you can see the presentation as it stands.
Yeah, it's all good.
Perfect. Brilliant. Let me know when we're ready to start.
I think you're good to go. I think everybody, like I said, if you can't talk, just raise your hand or write something in the comments section. But everybody should have talking permission. Yeah, you're good to go, Som.
Okay, I think on the HANA group, we've got a few people with some queries. Maybe they need some guidance, but
Okay,
right, let's get cracking. Okay, thank you. Thank you very much, Tanya. Good morning, good evening, and welcome everybody to another student clinic. Hopefully we'll have a few more regular ones now that you've all seen the agenda month by month going forward, allowing us to plan. And sometimes we're going to have lots of cases, sometimes 2 or 3, but that'll enable us to go in depth into each case. And the more we get into these, I'm hoping there's going to be a lot more discussion from everybody there and less talking from me. The whole point is your clinic. Put your ideas on, put your fears on there. Don't worry about getting the perfect prescription because it doesn't exist. We're working towards health step by step. So we're not looking for the one magic prescription 1 month and we think, crikey, it doesn't work. That's not the aim. So as we know, we're going to try and cover most of these things if the cases need them. However, I'm also aware that many of our students are on level 1 or level 2, so we won't go focusing too much on bowel notes, flower essences, and the meditative provings because they will come way later. Let's stick to good basic homeopathy to build up our skills on that first, because the others are just supplementary to that in essence anyway. But we will look at nutrition, herbs, and supplements as well, because that's going to be key. For those of you who've seen these before, this is the chart I always refer us to. It's in page 38 of Ellen's book. That will help to guide us when we don't know what's going on. So we may have to refer ourselves to that again and again. I'm hoping some of us have got materia medicas and repertories to hand or vision softwares. This is the Chinese 5 elements table or chart that we use. There is another version of it, a slightly different one. I prefer this one because it's simpler. And if those of you who are not familiar with this, don't worry, you will get there at your respective courses, but we will cover it and have a discussion around it. So you'll get to become very, very, very familiar with this chart. And we have the 4-legged stool, which we may use now and again if the conditions warrant it, and we can talk about that at some point. And we have the emotional pain chart. I've sent these before. If you want them again, send a message on the group chat later. These are some of the tools that will guide us and help us understand what's going on with our patients. So please use these to refer to again and again. If you want them afterwards separately, I think they're on the templates that I send out to people anyway. If not, I will make sure they are. And let's start using them. Okay. We've got 3 students today. Sharon's presenting first, then Randiraj, and then we have Azrina. Azrina's last because she's over in Trinidad. And I'm not sure if she's with us just at the moment. She's 4 hours behind, so it's going to be a very early start for her. And if you remember last time, Azrina has not yet received a materia medica or a repertory, nor does she have the vision. So she's going purely by the lessons and the theory that she's got in the head of how to repertorize. So if we can all muck in and help her out with some rubrics on her patient, that's going to be fantastic. And she's about halfway through certificate level, and she's doing remarkably well, albeit without any tools. Right, Sharon, are you there?
Yes, good morning.
Good morning, Sharon. Over to you. The floor is yours.
Okay. This is my patient, lady of 65. She's actually my mum, I'll be honest. She's very, very frail of body, but strong in nature, in spirit, I should say.
She's actually who, sorry, Sharon?
Hold on. Traffic going past. Right. She's 65 years of age. Can you hear me?
Yes. Did you say she's your mum?
She is my mum. Yeah.
Okay. Sometimes we always declare it when it's a personal member or someone known to us. It's
Yeah.
just a disclosure. But okay, thank you for that.
Yeah, there you go. I wouldn't usually say about a different patient, of course, but because it's my mum, I might as well tell you anyway.
Okay.
So, and therefore sometimes I might be giving my own insights, and perhaps you can help me to be a bit more reflective rather than emotionally involved. I don't know. So she's short, really. She was well, but before she was ill, she was never tall. She was 6'3" at most, but now she's sorry 5'3" at most, but now, you know, she's not even 5 foot. You know, she's lost all her height. She's quite compressed, really, because her body has deteriorated so much. So she's short, petite, frail, very frail, severely disabled and decrepit by chronic rheumatoid arthritis, osteoarthritis as well. Skin very pale, blue eyes, short dark hair, of course coloured, I think by now, but she has always been dark. Emotionally, she's, to be quite honest with you, she's better than she used to be, but she feels she has lost everything, as she used to be such an active person, full of life and able to turn hands to most things, really, and willing and wanted to do that. She feels frustrated in her body. There is suppression by husband, as in he is a strong character, but of course he's also a carer. I think she feels suppressed because she's stuck in her body, and she can't do much of anything. Easily irritated, and can be snappy, even though you're trying your best to help. Right, so her current medication, and this, believe it or not, is a lot less than it used to be. Levothyroxine, 100 milligrams. I've no idea what they are actually. Amlodipine, I don't know.
Right.
I can't even tell. You can see them on the screen. Yeah.
Yeah. Let's just try and work through them if we can, just so we all
Okay.
understand what they are.
Yeah.
Levothyroxine is a drug version of thyroxine, which means the
Yeah.
thyroid is underactive. Okay.
Yeah.
Amlodipine is a blood pressure reducing drug. It's called a calcium channel blocker. Bisoprolol, if I'm not mistaken, is a beta blocker, similar sort of thing. They often use beta blockers with calcium antagonists. They're the different classes of blood pressure. If Salish or Balgit are online, I'm sure they'll correct me. Bumetanide, I believe, might be some form of asthma inhaler. I could be wrong there. Somebody might want to Google search that quickly. Omeprazole.
She doesn't have an inhaler, no.
But it's a tablet, but it's like a steroid
tablet.
type. It's I think it's some type of beta blocker, but not for blood pressure.
Right.
Beta agonist rather. And I think omeprazole is for stomach ulcers. It's a proton pump inhibitor. It used to be called Losec in the old days. Prednisolone is a steroid, so it suppresses the adrenal glands, corticosteroid. And doxazocin is an alpha blocker, again used quite predominantly for blood pressure reduction, and sometimes in men for prostate when it's enlarged, not prostate cancer, but enlarged, and it blocks the urethra. But I'm thinking for your mum, there's probably a lot of blood pressure issues going on.
Definitely, yeah.
So that's what we're kind of seeing, a bit of a stomach issue if she's got the tablet. But often, if they're giving her lots of tablets, they often give omeprazole in their mind to kind of protect the stomach, which is rubbish, but that's sometimes.
Yeah, I think that's the route they took because, yeah.
Okay, so she's on quite a lot of medication there already. Okay, fire away.
Right, her timeline. She's the youngest of 10 children, 9 which lived, so she's the youngest of all of them. You know, she only, to her knowledge, she believes she only had the polio jab. She doesn't remember previous to that, and her mum's passed away, so she can't really ask. She lost her dad at 12 years of age. He died of stomach cancer. Met her husband, my dad, when she was 19. He had 2 children of his own, which she reared. It was a difficult period of divorce and the custody battle and so on. 23 years of age, I was born. 25, my brother was born. 27, moved to a new house, renovated. 32, rheumatoid symptoms. She believes after cleaning a damp house, a grandmother died and they had to evacuate all the furniture out the house because it was rental accommodation. And in that day, all they had was a lit fire really as heating. So after she died, the house got very damp, and she believes that the trigger to her rheumatoid was cleaning of that house, because both my dad and brother fell very ill just from moving the furniture. They had like flu-like symptoms, and she started to ache all over.
Just pause a second, Sharon. Now, on this house, you say there was a fire, you say?
No. You know, in the old days, you know, before the time of central heating and storage heaters and so on, all my great grandmother had was a lit fire.
Oh, lit fire. Sorry, I thought
yeah,
it was in the house.
to,
Okay, fine.
no,
fine.
to heat the whole house. If that makes
Okay.
sense.
Yeah, got it.
So once she passed away and the house had been left for a bit, it became very damp. And this is her belief that her rheumatoid kicked in because she'd been exposed to that damp house.
Okay.
She was there for days cleaning, and that my dad and brother, who were just there really for parts of the day taking the furniture out, they fell ill with flu-like symptoms, and she believes she became ill with this. But during that time as well, she does say that she was very exhausted in a way, because she was looking after 4 kids of her own. 4 kids and a set of grandparents, you know, and it wasn't an easy time for her either. So 35, she was 3 years before she was diagnosed with rheumatoid. So for 3 years, she was going backwards and forwards to the doctors. They didn't know what was wrong with her. They thought she might be depressed. She saw a specialist. He even said it was all in her head. That was just a psychological issue. And she paid to see another specialist, and he diagnosed her with rheumatoid arthritis. But by that time, her brother had just been diagnosed, and he referred her to the doctor. So it is actually in the family quite prominent. So 46, she had pneumonia. 47, she had a tumour removed off the eyelid. In that period, we can't remember really how old she was, but in that period, she had 2 knee replacements and a hip replacement. At the age of 60, she's had, again, an ankle, a sort of rod, which has been inserted into her ankle, which was very infected. And she was on ultravenous antibiotics and oral antibiotics for a long time. At 61 years of age, her kidneys failed. She's now a dialysis patient 3 times a week. She suffers with sleep apnea and wears a mask at night. Currently, I can't actually see the bottom of the page there. Currently infection in dialysis neckline pipe. So they've put her on a long course of antibiotics. She's just finished an very long oral course of antibiotics and ultravenous every time she's been on dialysis. So family history of cancer on the father's side. On the mum's side, a very prominent rheumatoid illness. So my essence, I'm thinking cancer and is it psychosis? I think, is it migraine? Yeah.
Okay.
Yeah.
Right. Take a breather. Well done. Thank you for sharing, and it's very, very personal to you because it's your mum. So why don't we all help to keep the slight objectivity there and some sensitivity because it's Sharon's mum. Right. Let's open the floor, because you know what I'm like. Most of the stuff that we need to know is on the first slide. So let's get our thinking caps on. What kind of picture are we seeing here, ladies and gentlemen? Anybody want to venture in?
Can I go, Sam?
Hi, Mariana.
Hi,
yeah, fire away.
it's Mariana. Hello. It looks as if this lady has suffered so much that her whole body is inflamed. So she's so angry with herself There is obviously lack of support from her dad because he died very young. So that's why the body is inflamed and starts self-destructing.
Excellent.
So anything in lines of helping her to battle her willingness to have a decision. Probably her knees are to do with her decisions, her hip as well. She cannot, her thyroid is probably her inability to express that. So anything along these lines, I would say.
Good. Excellent. Thank you very much, Mariana. Anybody else want to jump in with some perspectives here?
Morning, Som. It's Debbie.
Can I say something?
Oh, fire away. I think Deb was in first. Just hold fire for a second, Kalyani. Go on then, Deb.
Okay. Thank you. Hiya. I was just going to say the fact that when you started with the fact that her posture is so compressed, and then it says about being so suppressed emotionally as well. It's like that physical being put upon. And then I was just having a look at rheumatoid arthritis in the Louise L. Hay book, and it says that rheumatoid arthritis is emotionally linked to feeling put upon. So, but with a lot of the cancer there as well, it was just, yeah, that seems very linked in with that kind of experience and personality.
Can we, just to follow on Deb's, can we see here? I know it might be a bit small on your screens. We've got hips here, and I'll read it out loud if we can't see it. It says fear of going forward in major decisions, nothing to move forward to. And we talked about her knees, stubborn pride and ego, inflexibility, inability to bend, fear, inflexibility, and won't give in. So these are the kind of emotional links here. Over here, we've got some little marker. I've got to put my laser off it. It says arthritis, feeling unloved, criticism, and resentment. So it looks like we're getting a picture of that already based on what the ladies have just volunteered going forwards. Right, I think, sorry, Deb, just to support that there.
Yeah, no, sure. It does say about the resentment as well, which is interesting because of the talk about being a bit snappy even when people are helping. It's that kind of suppressed anger.
Yeah. Okay, thank you. Kalyani, I think you were going to make some comments.
Yeah, two things come to my mind. First is because the dampness seems to be trigger, and another thing, physically she's shrinking inside, feels suppressed, reminds me of calcab. I might be wrong there. And secondly, lot of suppression. First of all, due to a lot of medication plus emotional suppression, so very carcinosin.
Yeah.
Yeah.
Okay, thank you. Brilliant. Anybody
Could I
else?
just chip in? Yes, could I just chip in briefly, Som?
Hi, Francesca. Yeah.
Hi, morning, Sharon. The first thing that sprang to my mind looking at this, at Sharon's mum's notes here, her system is very acidic.
Yes.
And that will concur with everything that Debs is saying about the suppression and Cal is saying about the calcarb. And unable to express herself and unable to move forward and everything else. So her system is extremely acidic.
Yeah. Brilliant. Thank you very much, Francesca.
You're welcome.
Anybody else with some comments? Okay.
Yeah,
well,
I'll just chip in as well. It's Claire.
Hi, Claire.
Hi, just looking through the timeline, that feeling of perhaps you've given such a lot to a lot of people from quite a young age, and this is then carried on with the great grandmother and the children and cleaning the house, and then it's perhaps like not feeling nurtured in herself at all.
Yeah. Thank you. Now we're gonna step back and use some of the tools that we sat on the first couple of slides. So we're going to go back. I know we have another slide to this, Sharon. We will get to that, but this is why I always say that before we dive into remedies, before we look into methods and rubrics and what have you, just to analyze the case by looking at this is so important. And that's what we specialize here at CPH. Many people just repertoire, have a list of rubrics, come out with some remedies. If we listen to the picture, what do you think of the comments made, Sharon? Does that make sense? Because you know this lady.
I think it's quite a true picture, really. Yes, quite a close analysis. Yeah.
Good. Okay, so now let's try and understand it a little bit further. Just to mention a remedy that comes to mind, and I remember reading about it years ago, it's something you said, she used to be really lively, and now she feels like she's lost everything and has nothing to live for, which is quite a sad state to be. And that reminds me of the two remedies, phosphorus We learned this very early in modules 2 or 3 when we did the polycrest, calc, carb, silica, lycopene, phosphorus, and sulfur, and phosphoric acid. And I think I remember saying once before that when we got the acid version of the remedy, that is the person who's had that energy taken out of them and they become quite bitter and acidic. Because a normal phosphorus person is sensitive, quite lively, quite emotional, like a match. They light up the room when they walk in. But when their spark has gone out, like a burnt match, they become shriveled up, burnt, acidic, and quite bitter and resentful. So that phosphorus to phosphoric acid kind of fits quite well there. That doesn't mean that's the remedy, but it helps us to understand collections of remedies sometimes. And the same goes true for things like sulfur and sulfuric acid, two very closely remedies. Because one is the acidic version of the other when life has been sucked out of them. Think of it like a grape and then what's it called, a raisin or something, just dried up. So that's that, just as an overview. Now let's go back a bit because we've got a massive drug layer here. Let me just get my laser again, right? So we can be,
and that's actually short compared to historic, to be honest with you.
So we also got to remember that when we've got drugs like this, we don't know out of these if they're causing any side effects here either. But there's a huge drug layer, and I'm assuming it's more than a couple of years she's been on these.
Well, she's been on steroids since she was 35, and I think that's the main issue with her bones, really.
Right. So what do we know when we have steroids and we take steroids? Can we understand physiologically what they do to the body? No, they suppress the adrenal glands. The adrenal glands are called adrenal because they sit there adjacent to the kidneys. They sit on top of the kidneys, and they make things like glucocorticoids and mineral corticoids. I'm saying these was deliberately because the clues in the case, the clues in what's happened physiologically, physically, emotionally, but also it's kind of guiding us to what kind of remedy she's going to need. So there's a mineral issue here, clearly, because what are bones made of? Minerals. And a couple of minerals, calc, carb, people have mentioned, calc, phos, there's calcium involved there, there's phosphorus involved there. And we just talked about the phosphorus picture, which causes destructive metabolism, and we talked about phosphoric acid. It does not mean that these are the remedies, but it helps us think in that kind of area, what's going on. So we've got a drug layer here. We've got years of resentment. The minute we think about bones, if those of us who know the Chinese element, let me just pull up that chart, bear with me. And this is where we're going to use this now to help us understand the picture. Now let's focus down to the bottom here, psychosis. We've got the kidney energy here. Kidneys are the source of Jing, which helps to govern our qi, which flows through our body. If we look what they affect, the genitourinary organs, the yin and yang, the kidneys are the yin, the genitourinary organs and the bones are the yang. So we know the bones are being affected. The element, the emotion is fear of moving forward. So if her energy is tied up, the whole qi energy around the whole body won't flow correctly. Kidneys literally are the source of life. And many, many elderly people start getting slower down. They get puffy, they get edema, ankle swelling, heart failure, slow thyroid. This is all linked to this. And this is some of the stuff that we've got going on with this lady. Would you concur with that, Sharon?
Yeah.
Now, if we look at the top here, we have a syphilitic state. The emotion that's linked to that is joy. And when the joy goes out of us, we get to grief, don't we? So if she's not happy with herself, her body's going to start attacking itself. She couldn't express herself. I think Marianne touched on that, and that's why her thyroid was going. So she's just literally putting up with this life. Too many burdens, overburdened, over-responsible, bit of carer syndrome, looking after the grandmother. So when we've got people who are over-responsible, somebody mentioned, I think Marianne, that there's a calc carb picture. So we're starting to see key remedies popping up. And so what we're looking at is the major mineral salts that we might want to consider. That help us kind of fit the picture here.
Yeah.
She's getting issues with the tendons and joints. The body's attacking itself. She's not happy. She's angry. We've got the anger here. We know there's a liver issue as well. Why is the liver issue? Because if the liver is so backed up with having to detox these numerous drugs, the liver can't do its function properly, can it? Because it's been asked to metabolize all these drugs that she's on 2-3 times a day for 20, 30 years. That's why we've got a major liver issue. We have to support the liver. We have to support the kidneys. It's not that she's liverish and angry. The liver's too busy trying to detox the drugs over the last 3 decades. It can't even do its job of supporting the rest of the energy, can it?
No.
So the fact that she's angry doesn't help. So that's all bunged up there. Right. So is that okay on that picture on the first slide?
Yeah.
Shall we go to the second slide?
Okay.
Fire away.
Okay, so this, yeah, here we are. Has been suppressed and exhausted by a dominant partner and care over 4 kids and grandparents from a young age. Husband belittles her and demanding, even though I love him, honestly, but I can see it as well from both perspectives. Rheumatoid from a young age, which was treated with steroids for many years, eating away at her bones. All joints have finished. They're all finished. So, right, cause effect here. Her belief, cleaning damp house which probably had black mold. Husband stepson fell ill with flu at the same time. But she was also very run down at the time. As I said, felt dominated by her husband and exhausted from caring for 4 children and grandparents. So shall I go to the method or?
Yep.
Okay, method totality. Mind ailments from suppression, ears stopped up sensation. She she has a ear popper, which I found on the internet really. So, but you puff air up the nose and it actually opens her ear canals and so on, and it actually works quite well. Then she can hear, but usually her ears feel as if they've just been closed. There's no noise, you know, nothing. They're
No
just
problem.
stopped up. Bones are crumbling. One thing I didn't actually put in the first one I've noticed was her neck is actually it's more or less balancing. And the bones have crumbled so bad in her neck that it's balancing. Joints, rheumatoid general, all through the body. Kidneys weak, function defective. Legs swelling, lymphatic. Breathing difficult, sleeping during. General broken bones, frail and easily broken.
Stop there a second, Sharon. Now, just tell us a couple of things there, please, because a lot of what we've just discussed on the previous slide is there, isn't it? The kidneys, the swelling, the edema, the breathing difficult. It's telling me heart failure. Heart failure is the people looking at the heart, but what's jumping out the page at me, and I could be wrong, correct me if I'm wrong, people, is the kidney energy. It's all about the kidneys, this. Okay, we'll come to that in a moment. You say her breathing's difficult. What's her weight? We've talked that she's short and frail, but what's her body weight like? Is she short and skinny, short and a little bit tubby?
They've actually worked on putting weight on her, so she's been having these shakes and so on. I can't recall what they're called now, but she's literally skin and bone, but she has put a bit of weight on her tummy and, you know, bum and so on, which they have worked on. But before, she was literally skin and bone.
Oh dear. Okay, fine. Right, far away.
Okay. Right. I was thinking organ support for the kidney, Berberis Volk, and Nux Vom to detox the drugs, the drug layer, carcinosum for the suppression, and as I've noticed, there's actually concern. There's an infection in her dialysis entry pipe or the area. So I was considering calendula to treat the infection and tissue salts. I wasn't sure. My main concern here is that she is so frail that I actually don't want to shock her by giving a what do you call it, a remedy, really. And this is where I wanted your opinion. I was thinking, is it better to support the body first with the organs and nutrition or whatever, and then consider repertorising? Well, I know I've done it, but giving a remedy.
We'll answer that in a moment, Sharon. I'm glad you said that, because it's a very interesting case. Good choice in the method, the totality method, which is focusing on more of the physical symptoms first in the order in which they present. I get that, and only 1 or 2 mind elements. I'm just going to take us back to our 5 elements chart again, and then we'll come to the repertory. I think I did a little rep for you as well, and things come to mind. But let's just go back to the 5 elements. And Baljet did an excellent case in the week. I don't know if she's online, but bloody well done, Baljet, on her daughter. She's on about the meridians. And if we look at the kidneys, they said they're on the same meridian. Marquetta will talk about this because she's quite into the energy flow as well. And look where they open, into the ears. Now, what we've got, sorry, we put it on the laser again. We've got a lady here who's clogged up, congested, suppressed emotions, suppressed by her husband, suppressed by life. Life is crap. It's just honed in and just get on with things. You can't even be yourself. So everything's blocked up and backed up. And as Francesca said, she's quite bitter, resentful, and acidic inside. Not helped by the drugs, definitely not helped by the antibiotics in. So her gut flora is all over the place. She can't even get her stomach lining right. The omeprazole doesn't help. And a little known fact, or actually a commonly known fact nowadays, should be amongst our community, when we take what's called a PPI, a proton pump inhibitor, your omeprazole, your lansoprazole, your pantoprazole, there's a couple of others out there as well, but omeprazole seems to be the main one. If you read the small print, it says do not give to people over 65 years of age in that little patient information leaflet. And it also says may cause kidney failure. This is exactly what she's got. When we take a proton pump inhibitor, we say, oh, I'm taking ibuprofen, it's to line my stomach. Part of my language, what a load of bollocks. Because it comes in as a drug, the liver has to metabolize it, the kidneys have to excrete it. But because it's a foreign substance, it actually has a very, very severe adverse effect on the kidneys. Now, your mother, this patient, doesn't have mild stage kidney. She's got first close stage kidney failure. She's on dialysis.
Yeah, she's stage 4.
She's on stage 4. Okay, so that's quite serious.
Stage.
She's on dialysis, exactly. And it's either a kidney transplant or it just gets progressively worse.
Well,
okay?
she won't get a transplant.
Right, so there we go. And we know the kidneys have been severely affected because she's had two knee operations and a hip replacement?
Yeah, and an ankle.
Bloody hell. Right, so like you just said, she's literally crumbling to bits.
And to be quite honest with you, I've just remembered she's had cement in her back as well.
Cement.
In her back.
Yeah, and what is cement for the bones? It's calc phos, isn't it? Right. That's our homeopathic cement, isn't it? Okay. Calcium. We talk about the picture. We talk about the calc carb picture, overburden with responsibilities. Absolutely correct, those of you who mentioned it. We talked about the phosphorus picture. The key line of phosphorus, I'm sure people sitting there with the Materia Medica right now, right at the top of the page, it says causes destructive metabolism of the body, especially the bones. So we know what phosphorus does. They've got something there called the phossy jaw. It causes necrosis, which is an absolute crumbling. It's exactly what you've described. Yeah, so we've got a calc carb picture, overburden, over-responsible, thyroid slowdown. This all points to calc carb. What is calc carb? Calcium carbonate and a mineral level. Then we have the phosphate picture of total absolute destruction. And then we've got the magic remedy that puts the two together called calc phos. And if you repertorize bones, joints, hip joint, calc phos is going to come up. Aurum's going to come up. Eup perf is going to come up. Acellus will come up. These are 3 or 4 key remedies here that help to nourish the body. You're absolutely right. Because she's elderly, frail, weak, debilitated, kidneys aren't working. The totality method will work quite well. Let me just get out of this for a second. And for those of us who haven't yet covered it, we've got the totality method here. This is exactly what you've done, which is absolutely fine. Even if we know the cause of these symptoms, mental, emotional, can we cure this now? No. Why? Because she's a kidney failure patient. So for us to focus on the mental emotion now will not help this patient because all her energy is tied upon these weakening kidneys, which is further exacerbating the symptoms. Would that be a fair comment?
Yeah.
So we can try and say, oh yes, dominance, ailments from domination, blah, blah, blah. Yes, we know that's the cause. But right now, she's going to dialysis a couple of times a week. So we really got, and so she's going to be weak, exhausted, because with dialysis patients, when they come out the next day, they can't do anything. They're totally worn out, aren't they? It takes all the energy out of them. So you're absolutely right in your approach that we've got to be gentle, we've got to be slow, and we've got to take it easy with her. And we've got to nourish her body. So I think your tissue salts is a brilliant, brilliant starter for 10. That's definitely needed. Because that's got calc fluor, calc phos in there at a 12x as well.
Would you put all 12? The only concern I had with the 12 was the silica. Is it, and no, with all her artificial joints?
No. Okay, it's not going to make her knees pop out. Please don't worry.
I don't know. Okay.
No, I'll tell you what, my mum, bless her soul, she had a pacemaker in. and it didn't pop the pacemaker out either. It's not going to make, it's not, don't worry about that. But it's a common question to ask because we know it's the homeopathic scalpel. It's the same with people who have dentures or fillings. It's not going to make the filling pop out while you're having your cereal. But you know, it just gently helps the body to remove foreign objects, not implants. However, silica, now when you said she's small, she's frail, other than she's got the blue eyes, she doesn't really have the fair hair, but she's in a very silica state. What is silica? Want of true grit, fragile, easily crumbling. What does silica do? It's on the surface of the earth, isn't it? The crust. It's a fundamental element of good structure, bones, cartilage. It's absolutely needed in this case. So to give it in the tissue salts, brilliant, brilliant choice. Okay, nice and gentle. We're going to talk about the organ support. So I'm going to venture and put forward on the table. We have a method called the layers method. So some people will have covered it, and those of you that haven't, don't worry, you will get there. And if you're thinking, I can't wait, flick through Ellen's book, it'll be there anyway. The layers method is saying, like an onion, there's multiple levels on this patient. And the first thing we say is there's a massive drug detox layer. So we know we have to deal with that. Because that could also be the obstacle to cure, couldn't it? Or it will be. Now, Francesca touched on this. She's very acidic. She's anti-antibiotics. That means her gut flora is all over the place. We don't know if she's constipated or not. I don't know if it's worth asking. We don't know
no, she said she's okay like that.
How is her going to the toilet for a wee? Because also at that age, sometimes.
Well, not. She's very limited on how much she can drink. Yes. I think she's only allowed 700 ml a day.
Now, this is interesting. Because she's on the dialysis, they have to put her on this. And yet, she's in a very dehydrated state. And it's funny that you said she's had cement put in. And I was talking to someone literally the other day. Can't remember if it was a student or a patient. And we talked about sand and cement. It's the best way I could describe bones. If you have sand and cement, you can make concrete, you can make cement, you can make all sorts. The missing ingredient is water. Otherwise, you've got a pile of sand and a pile of cement, haven't you?
Yeah.
But 1 part of cement to 4 parts of sand, blah, blah, mix it around, add your water, you've got a mixture. Change the ratio, it turns to a different consistency of cement, concrete, or whatever. So that's how the body works. So we have sand and cement, our calcium and our phosphorus. Without the water, they can't combine and do what they need to do.
No.
So isn't that interesting? And there's a book, I'm sure we talked about it at the last clinic. It's called Your Body's Many Cries of Water, something like that. And it says, you're not ill, you're dehydrated. It's a book I highly recommend that we all read. I've read it many, many times. Brilliant. Because you can treat someone, you can stop someone having an asthma attack with a couple of glasses of water. You can reverse arthritis just on water alone. Do read the book. I'm not going to give you the answers right now because that's not what today's about. Not just for yourself, that's for all of us to read. Fantastic book. And if you don't know,
what was the name again? Sorry.
I think it's called Your Body's Many Cries for Water. I know we have some very resourceful people on the group chat.
It is
probably send a link from the Ohana by the time we've finished.
Okay.
So that's something to think about. So I think the layers method would be appropriate here to go in gently, slowly, and nourish her. Now, if you think back to Ellen's webinars, for those who listened in on the gut, if she's acidic and she's inflamed, she's not even absorbing her nutrients from her food. If she's on dialysis, she's going to be on a very severely restricted diet as well, what she can eat, what she can't eat. They might have even put her on something called a potassium sparing diet. Can't eat bananas, can't eat too many potatoes, blah, blah, blah. So there's going to be whole loads of stuff like this going on. Lots and lots of restrictions. So she can't really pull the nutrition from her food because her food is restricted. Does that make sense?
Yes, I don't think she is restricted on her potassium anymore. To be honest with you, I think, because she's in such a end stage, I think they've just, let her be, which is an awful thing to say. Yeah.
Isn't that sad to hear? Right? Because they're thinking, right, we're not even going to restrict her, just let her be, and she's on dialysis. Right. So there's a lot we can do there, a lot, but we've got to be gentle with it. So that's fine with yours so far. Optivac, any kind of probiotic will be great. There's lots of different brands, and we all have our favorites. Optivac tends to be a CPH favorite amongst many others as well. So far, so good. Let's just move forward to the rep, because I think I did a bit of a different rep as well, to give us some insights. It doesn't mean we use it. It's also to help us learn that there's 2 or 3 ways to skin this cat, okay? And then we'll talk about the prescription, because I think we need to address the kidneys and the kidney failure quite soon, in amongst the tissue salts and the drug layer.
Yeah.
But before I go further, any comments from anybody else at this stage?
No.
Okay.
Yeah, just very quickly, the one thing that came up into my mind, sorry, it's Francesca here, whole gut-brain axis. The gut is being affected by the taking in of the steroids over a protracted period of time, and that has, as Som has said, caused the gut not to function optimally. And so the gut-brain axis would also affect the whole communications between the brain and the gut. So working with that, if the elimination channels are open, that would support detoxification of the medications. And if the whole gut-brain axis is supported, it would help to ultimately trying to cleanse and clear and return to homeostasis.
Yes. Brilliant, brilliant point there, Francesca. So we're almost getting to the prescription now, which is good. Let's just cover some of the rubrics that we had on the next slide or two and come back to this slide and come together for a prescription for you, Cheryl. Is she going to be okay taking remedies like putting a pill on her tongue?
Well, yeah, she's got carers 4 times a day.
Okay.
So, you know, she's in that way.
Can you trust them? Because she's on a restricted intake level, a water tablet, LM potencies are not going to be appropriate here. Sometimes we use LM potencies because they're gentle, they're deep, and they work through a drug layer. Oftentimes, they're recommended to go in droplets of water, put them in water. If a water intake's restricted, I think it's sticking to basic pills on the tongue if we can. Okay?
Okay.
Right, let's just go through some of the rubrics. I know this is stuff that you put together, and I love what you wrote here, considering not giving this until the body has been supported. Bang on. We don't always have to go in guns blazing. So we've got some physical particulars here, which is fine. Ear stopped up sensation. And look, we've got lycopodium, which is a major liver remedy. Anyway, it's a major angry remedy, not a problem. Bones crumbling, rheumatism, some good rubrics, physical particulars, absolutely fine, in line with the totality method. An alternative, if we look at a fundamental layer, fundamental in the layers method is who has she become? And we're not ready to treat her on this yet. But this will happen after the drug detox and the organ support has happened. Okay, so we're gonna think ahead, because hopefully, you know, you might have a follow-up in a few months' time, or even if you don't need it, at least you have the tools here from which you can help her with Sharon. That's the reason for doing this. So it's not just right here, right now. It's your mother. You want to keep on top of things with her quite regularly as well. And I'm hoping you can talk with your supervisor offline as well. You've got the Johanna group as well. Let's support her as much as we can. Now, if we look at the rubrics here, it says what it is, and this is using the fundamental elements of who she becomes. So we've got the 3 or 4 main mental emotionals there, 1 or 2 physical particulars. And if we can see what I like to do when I repertoire, I love repertorizing because it teaches me so much, not just to come up with the remedy and the scores. That's not always the best way to look at it. It also tells us where the 4s are in the case. Hopefully you can see my red laser. And that tells us which remedies that we should also learn about and think about. And when we think of liver, we often think of things like nux vomica, hydrastis, etc. And as I tell the students that I'm tutoring myself, we know that lycopodium is a major liver remedy, major right-sided remedy. But it's not just the focus right now. We've got lycopodium coming up here. We've got arsenicum coming up here. Heart cancer, quite a syphilitic, very, very good remedy, burning, lots of destruction as well. It's interesting to note here that you don't really have phosphorus much because we're not dealing with the bones. But yet, if you go down to the liver again, we've got phosphorus down here, highly rated for the liver. Major polyquests affect all the organs. And that's the good thing to remember here. So this would be a potential remedy 3 to 6 months down the line once you get this drug layer in hand and keep her kidneys okay. But we're not here yet. I'm hoping for a good prognosis 6 months, 1 year down the line, and we start treating her with lycopodium. Lycopodium, intellectually keen, weak in the body, which is exactly what she is. So constitutionally, that would help her then. Lycopodium is also part of the polyquest, sulfur, calc, carb, lycopodium, and they follow well in that order. Calc, carb follows sulfur, lycopodium follows calc, carb. Right now, she's not in a calc, carb state, she's in the kidney failure state. So we're going to ignore this, but it's there. And we're going to go back now to the patient. Is that okay? But the interesting thing is, what you repertorized also came up with lycopodium. Now, isn't that interesting? And phosphorus.
Yeah.
So that's also very interesting to note that your remedy, just on your physical particulars, came out also when we went through the fundamental method with the mental emotionals as well.
Yeah.
So that's
And
also a very, very key point to note.
I noticed, I was reading, it's a tomato, is it lycopodium? Or not? Have I
Can you
gone?
say that again?
Is it tomato, like lycopodium or not? Have I mixed up remedies, have I?
Tomato.
Yeah, it's not.
I'm not familiar with tomato, so somebody correct me if I'm not fully awake today, but I don't believe the
No,
connection with
okay, so I
tomato.
mixed up, so
Lycopodium
that's something
called,
else.
that's okay. Lycopodium is called club moss. I'm not a botanist, so I don't know that much about it as a plant, but I know how it works in our body. Right. So if we wrap this up now, Sharon, what we've got here, right? You've got a great idea with the nux vomica and carc, and or the tortopathic method, which is a drug detox layer. Now, if we go back, so one prescription is going to be nux carc, and I call it T for tortopathic. So NCT is your drug detox combo that you always think of.
Yeah.
Now, out of all of these, the theory behind the tortopathic layers, you'd start with the most damaging drug first and give that back in potency. And the way we look at it this way, we've got a lot of adrenal suppression from her steroids. And it's a bit of a toss-up between the steroid and the omeprazole because they're both very, very damaging, very, very suppressive. If the body's suppressed, it can't function properly. Can't function to the point it's shutting down and the kidneys are failing. So my suggestion would be to give omeprazole and prednisolone back in potency.
Okay.
So you've got your nux carc, prednisolone, and omeprazole. And prednisolone, if someone's got a Sulis machine, there's a rate in there. I'm sure somebody can pull up an omeprazole rate. I'm sure it's in the booklet as well.
I have actually got a machine now.
Good. Well, the other way to do it, if you go and visit your mum and you get the tablets, put them in well one, copy it across, make your own 30C potency into your pills of the tortopathic remedy. That's how many of us do it.
Okay, so I'm sorry, nux vom, carcinosin, and those two, 30C.
Those two for now. Yeah, I will start with them, okay? Just as a side note, for those who do have Sulis machines, this is why I don't know the rates for our tortopathic, because I don't do that. When I have my patients, I had to get a couple of packets, a couple of pills from them, put it in a little clear plastic sleeve, put it in well, put it across to copy, and copy it across at 30C. So I've got little vials of my little homeopathic pills at 30C copied of the tortopathic remedies. So just like you have a Nariani kit, I've actually got my tortopathic kit. And I got that from Ellen when she was young. She used to say she worked in Ilford and she goes, all she did was collect remedies all day long. Patients came with bags of pills and she copied them. And then you make your own mixture that way, which is quite a nice way to do it.
Okay.
So there's a little top tip there for Saturday. But that's one approach, one layer. We definitely need to give her some adrenal support. But before that, we need to give her some organ support. We need to support the liver. The nux vomica is going to help there. Now we need to focus on the kidney support. So you've got your drug detox prescription, nux carc T. Now, if you think about an organ support, and this is where you can put your Chesler's tissue salts in as well. You've got berberis in there, fantastic. Now, we talked about this earlier in the week to someone on the Ohana group, a fantastic little remedy for kidneys, especially for kidney failure, almost as specific as eel serum. And I think in the repertory books, it's called serum anguille.
Sorry, you cut. I couldn't hear you there, son. Eel
Serum. But if you look for eel serum, you won't find it. If I remember, correct me if I'm wrong. It might change in Murphy's new edition, but it's called serum, S-E-R-U-M, anguille, A-N-G-U-I-L-E, and that's eel serum. It's a specific for kidney failure, not kidney support. And I use that, and I've got a kidney failure combo that I use: serum anguille, terebinth, and equisetum. They're my three.
Could you send me these later? Because I'm not going to be able to spell them.
So I'm sure someone's going to probably write it down and ping it on our little organ group, our Ohana group.
Oh, thanks.
The combo is.
Sorry, what was the second one?
Right, I'll say it again. I'm sure someone will, because obviously I'm on a computer on PowerPoint here. So I'll say it again. We've got serum anguille, equisetum, E-Q-U-I-S, terebinthina or terebinth, T-E-R-E-B-I-N-T-H-E, and then you add in your berberis. There's a fifth one you can add in, taraxacum. You put them in as a combo. Someone will hopefully write that down and ping it on our group later and we can all share it. You put that in at 30C, give it that twice a day. Add to that well, I hate saying it, your tissue salts. Shushless tissue salts, tongue twister for me. Put your tissue salt into that mix for her. You're going to nourish her body.
Okay.
and then give her the drug detox at night. Why? Because the time of the liver is in the evening. So you support the drug detox. Leave her on that for a couple of months.
Okay.
Stabilize her. The tissue salts at a 12x will nourish her at a biochemic level. That's why they're called biochemic tissue salts. There's nothing in them. They're potentized, and in the Solace machine, it's just energy anyway. But the energy frequency is at a low level to stimulate them organically at a biochemic level. The rest is going to work energetically to rectify. Now, you could go in and put in as a SAR code, which helps the tissue behave normally, kidney, as a SAR code into your kidney support. So there's your 5 or 6 remedies for the kidney support. Does that make sense?
Right. So the Sarcode kidney, that would be in the same mix as, or would
Your
that be
kidney
a
support.
different?
No, you put it in, because in your head you want to compartmentalize. You've got your drug detox prescription at nighttime, and then you've got your organ support prescription, which is all of this.
Okay, so that's in with the organ support, yeah?
Yeah.
Okay.
Yeah. Now, me personally, because I know lycopodium's come up on your totality method, and I know it's come up fundamentally, I'd like to put some lycopodium 30C in there to keep that ticking away as well. And I'd put that into the same mix. So you've got a 6-7 remedy combo here. Rather than, she's old, she's frail, she's not looking after herself, she's got carers. If we give a complicated regime, nobody's going to stick to it. So we've got to say, give this 2 or 3 times a day. Every time they feed her or bathe her or change her. And then at nighttime, here's a nighttime dose. And sometimes in our packets, we often say 1 at night, the other one 3 times a day, or morning and noon. It keeps it very, very simple.
Okay.
Because she's elderly and she's not, at the moment, not responsible for her own intake of medicines, drugs, food, etc. The carers are helping her with that. The only hope is that they actually do give her these remedies. They won't interact with anything. They won't interact with the drugs. So I hope they're not thinking, oh my gosh, we've got this pill box here and we've got these remedies. So that's something you're going to have to try and manage yourself there, Sharon.
Yeah. With the 2 at night now, this is something I keep questioning sometimes, is because you've got 2 different you're giving at night, is it better to leave a gap between them, or does it not matter?
Sorry, you're not giving 2 at night. You're giving your tautopathic remedy at night, okay? If she wasn't that complicated, sometimes you can give a tautopathic layer 30C twice a day. But in her case, she's been on this 30 years, so we're going to go low and slow. She's frail, she's gentle, so we just want to stimulate her very gently.
Yeah.
So that tautopathic is her nighttime dose. That's it. The organ support dose, you can give it in the morning and the afternoon, or morning and noon, depending on what the support is like. Some people have a nap in the afternoon, so they're going to miss their dose. And this is where we have to be aware of compliance with the patient. We can write all the regimes on here, but if we know the patient's not going to take it, it's not going to do them any good.
No.
So for her, we've got to simplify it as much as we can. Once we get her underway, she starts to feel a bit better, then we can move that along. And because she's so frail, I wouldn't go in with equisetum and serum, eel serum at 10M. I'll start at 30C. Let's build up her resources a little bit. And that might take time. But if everyone else has given up on her, well, we're not going to. Simple as that.
Yeah.
So that's my take on here. Now I'm going to pause. I think this case is done, but let's open to the floor. Any questions, comments, or observations from anybody?
Just with this kidney sarcode, is there a specific name for that I'm looking for, or not?
Someone somewhere who's got online access to Solace will probably go into organ rates, or just type in the rates search and look for kidney, and it should come up with a list. If not, we can find it offline after and just drop a text on later. We will find that rate for it.
Okay. Thank
Solace
you.
will try and sell you a rate book saying, oh, buy the rate book, is £20. You go online, type it in, you can get the rate there. And once you've got it, write it in your notepad and make an addendum into your own little pad and call it organ rates, and just add them in as you learn.
Okay, thank
I've done
you.
it for things like adrenal, for testes, for testosterone, for all sorts of things. As you learn with your cases, you're going to pick up things like this anyway.
Okay.
Because when I give adrenal support, I tend not to give cortisone. I prefer to give cortisol, and that has a different rate as well. So, that's finding your own way as you go. Okay.
Thank you.
Any questions from anybody before we go to the next case?
Yes, please.
Hi, Karina.
Hi, how are you, Sam?
Very good.
I didn't understood one thing regarding the kidney sarcode and the tautopathic remedy. Shouldn't this be given in a second phase?
No. You could
even the tautopathic, you can give it in the first phase, like in the organ support and detox.
Absolutely. Well, if you think about this, first of all, let's dispel some myths in homeopathy. There's no should or shouldn't, can and can't. You can do whatever you choose. It's just energy information, okay? Second thing is, we've got a massive drug layer here. If we're looking at the slide here, all these. So this is our obstacle to cure. So even if we went to the fundamental layer and gave lycopodium, it won't work because our obstacle to cure is going to be our drug layer. So if we're not addressing the drug layer, this is going to be futile. The patient's going to turn around and say homeopathy is rubbish, it doesn't work. It's not because it doesn't work, it's because we're working at the wrong level in the first place. So that's what we say, we remove the obstacle to cure. But also, a lot of the cause of the symptom she's got is because of the medication she's on. Now, she's dealt with fear and oppression, suppression her whole life. So the kidneys are going to be affected. We know that because she's had the arthritis, all the rest of it from a young age. At age 30, rheumatoid symptoms started over here, okay?
Yes.
So we know that already she was fearful because kidneys deal with the fear. However, she's given omeprazole, which further causes kidney failure. She's already got kidneys that are fearful, kidneys that are not functioning, which is why her bones are going. We give a drug that's totally going to destroy the kidneys. She's now got kidney failure. So is it the case of cause and effects here or the obstacle to cure? At least get rid of the poison in the body first, which is why it's called drug detox. And then the patient picture will clarify and will show us other things later. It does not mean that we give that for 6 months and we go straight to lycopodium, because what it might mean, the symptom picture will change in 3 to 6 months. Then we repertoire again, and lycopodium may no longer be appropriate. It may be something like calc phos, because the picture's clearer. We don't have to worry about calc phos now. Why? Because it's already in the trustless tissue salts, along with calc fluor, along with silica. So all this thing we talked about with this patient, about the grit, about needing this, she's got natmure in there, which is the water distributor. Because I think you said in here, this patient's quite dry. She's dehydrated.
Yeah.
Now, natmure is a tissue salt in there, will distribute the water in her body correctly. Calc phos is the sand and cement. Once the water is distributed, the body will start to regenerate itself. It won't do anything while we've got the drug layer on top, which is why the drug detox layer is so important in this case. And because she's frail, low vitality, on dialysis, which literally sucks the jing out of her, the life out of her every time she's on dialysis, we have to go very gentle, very slow, very low. Does that make sense?
Yeah.
Karina, brilliant question to ask. Thank you.
Thank you.
Anybody else?
Sorry, I have a quick question with regards to the aurum that came up on the fundamental repertory.
Brilliant. Well spotted, Francesca.
There are lots of different kinds of aurum. So would we be talking about aurum sulphuratum, aurum metallicum, aurum iodine? Which would we be looking at exactly?
There's a couple more as well. There's aurum muriaticum and there's also aurum muriaticum natrum.
My apologies, I just picked out the first three I could think of.
You're testing me, my med now. Aurum muriaticum natrum as a side is a fantastic drug to add in for people who've got fibroids. You might want to stick that in your therapeutics book, ladies and gentlemen. Very, very useful one to have. This is aurum metallicum, the aurum picture.
Yeah.
Aurum picture is one of depression, sadness, despair, grief, as you can tell here with the fours, suicide in some cases. Now, aurum is going to come up quite prevalent in the cases today, but aurum is also a major bone remedy. Major bone remedy. And if it doesn't come up in your repertory, this is why we always say, combine your repertory with your MapMed. And those of you that know who I'm tutoring, I always say, read your MapMed. Don't just read the big bold things that jump out at you. Read that little introduction that Murphy's done.
Is that actually gold, is it? Or
it's gold. Aurum is gold. It's
which
the Latin
is funny, really, because it's the only metal she can stand on her body.
Well, what is the body telling her that it needs?
It needs it, yeah.
So maybe if you wanted to get a little bit fancy here, you could give her aurum 200C on a Saturday, Sunday.
Okay.
That depends. Or you could give her aurum. Actually, the other way is, Sharon, if you go and see her every now and again, why don't you give her aurum yourself at a 10M? Because you might go once a month or once a week. I don't know how often you see her. Because that way you're responsible for that part, not the carers.
It's interesting because when we were talking about the fact that she has given up and that she feels that she has nothing else to live for.
Yeah.
The first thing I thought it was about aurum.
Yes.
I think it has the mental picture. It it's good. But I didn't know that Aurum was also good for the bones, so it makes even more sense.
It's an amazing remedy for bones. I actually give it to my bone patients, I wouldn't say all the time, most of the time, along with Acelus and Eupatorium perforatum, UPerf. So it's a brilliant remedy. It is worth considering, and you can give it intercurrently. Now, if you had a patient in your care who's totally with it, you of course should give it what you call intercurrently. But because we've described this patient as being cared for, or like I said, the best prescription in the world means nothing if it's not going into the patient. So because the limiting factor and the unknown factor is the carers. They might just be flushing them down the toilet for all we know, you know. One of our students who's online with us now, we were talking in the week, we had a patient who had to go to hospice. So we did not know if that patient was having the medicines or not, because we don't control that element. So there are factors outside of our control. Very well spotted. And we say this all the time. We don't just read down and get the scores on the doors here with lycopodium. What I always do, I always look at the high scoring forces and say, why are they there? What am I missing? What do I need to learn more of? And that way we absolutely strengthen our knowledge of remedies. So yes, Aurum, great one to consider. You can say, why aren't you giving it now every day right now? Because right now she's in kidney failure. As Ian Watson would say, where is the energy tied up right now? In her kidneys. And what's happened? She's given up, despair. She's kidney failing. Kidneys are failing, they're giving up, they're in despair. And from the Chinese element point of view, the Jing has gone. From an Ayurvedic point of view, her root chakra's gone to pieces. There's no basis there anymore.
No.
So any which way we look at it, everything points to the root chakra. The kidney source of Jing and the flow of Qi is the kidneys. So we have to focus there. If we don't, we're missing the trick. The kidneys will continue to fail. Theoretically, we've got a great fundamental prescription in lycopodium and Aurum, but the patient isn't getting better because we're not addressing what's actually going on right here, right now. Which takes us right back to that chart we always do in the cases. We go right back to this one. What's going on and can we cure it now? We know it's mental motion. Can we cure it now? No. Why? Because she's on dialysis 3 times a week. So we have to go part patient until we can go up here and say, yes, we can cure it now. Then we take the Aurum lycopodium full term. If the patient was in care of us, we could give lycopodium and Aurum intercurrently. Does that make sense?
Yeah.
Yeah. So at the moment, we're in the part patient here because we're dealing with a lot of unknowns here. And we're dealing with an end stage kidney failure patient who is not qualifiable, eligible for a kidney transplant. So
Well,
we have to work
it would
there.
kill her. The operation would kill her, wouldn't it?
Right.
You know?
So the only choice is to try and revive the kidneys where we can. And if you read Serum Angulae in depth, and that means every little fine print with a magnifying glass, you're reading there, and right at the back, I think the 4th or 5th page of notes in the Materia Medica, it will say things like, these people have reverse kidney failure. It's a life-saving remedy. And I'm sure in one of the audios, especially in the postgrad course, it talks about giving it at 50 M to save kidney patients.
What was that? Sorry, Sam? What remedy?
Serum Angulae, eel serum.
Oh, yeah. Okay.
Yeah? And also equisetum. So these are the anecdotal stuff over the last 50, 100 years that people have used to great success.
Okay.
So we want to build her up where we can go deeper and deeper and store the energy. But right now we can go low because why? What does the theory tell us about potencies? If we're working low at a local level with the organ, we don't need to go too high in the potencies. So we know that the 30C will help definitely. Giving it twice a day, giving it a little stimulus to keep it on track. So that kidney combo is a really nice, powerful thing to add to the repertoire of our combo mixes. Well, I need a glass of water. Go on.
Can I have?
Sorry,
can
Karina.
I ask? Yes, I wanted to ask something to know the opinion of others, because I've read, I don't remember where, that the kidney energy, so the chi that you are stores the kidney stores the chi that you are born with, right?
Yep.
And what I read is that when you deplete it, it's impossible to create new chi. So it's like you have a certain amount, and you cannot, like when it's finished, you die, and you cannot put it back. If you misuse it, I don't know, with fear, drug consumption, things like that, you will not be able to bring it back. You can only use the left wisely. Is that
right? I'm not God. If you're not spiritual, I'm not the universe.
I mean, this is like in the Chinese medicine.
Yeah,
I mean,
no, I get it.
did I understood well this theory or maybe I misunderstood?
Okay, Karina, I think it's a very good point you raised, and this is where we have to use. Sometimes we have to use our common sense. I remember when I was a student, Ellen told me, she goes, simple point, where there's life, there's always hope. Okay, that's the first thing. Some people say philosophically or spiritually, there's a reservoir of energy. You have so many heartbeats left. If your fate is written, you're going to die at a certain time. I don't know that. I don't subscribe to it. I would say stay well for as long as you can. Because if I do that already, I'm already starting on the journey telling myself I'm limited. And if I tell myself or I believe that, I'm projecting to my patients, you run out of time, good luck, start preparing for your funeral. I'm not prepared to have them beliefs in my mind. So even if they're true or not, I personally decide to dismiss them, because I won't be held to other people's paradigms that way. And I've seen remarkable recoveries in patients who are at death's door. At the same time, we've lost people, and we're going to talk about this after this case, actually. We're going to take time before we go to the next case. So that's a very good point. Yes, it's the source of the Jing. Do I believe that you have everything you need from your birth? No, because I also believe we're in charge of our life. If I want to poison and destroy myself, I can kill myself quite easily with drink, drugs, and tobacco. So there's a number of ways that I would say no. That's my personal belief. Other people will probably talk about it on the Ohana group offline. It's a worthy discussion to have if you're so inclined. I'm on the other side. I think let's just work with the energy we have with the patient and see what we can do to the best of our abilities. So thank you for asking that. But my simple answer in the word is no, I don't think it's running out when we're born with it.
No, but is that what my question was? Is this really what in traditional Chinese medicine is this the base theory? Because when I read it, I thought the same as you. I thought, okay, it doesn't make many sense, but maybe I didn't understood it well. So I'm not trying to debate if it's true or not true. Is it really one of the bases of the Chinese?
Right. Okay. Right. Let me answer that in two ways then. When you practice, you find your own path in homeopathy, and homeopathy finds you with things that resonate with you. If a principle resonates with you and you believe it to be true, then it's true. Simple as that. If you don't, dismiss it. If you feel it's a principle that you can adopt into your practice, by all means use it. Absorb what's useful, reject what's useless, add what is uniquely your own. That's the best advice I was given. It's the best advice I give to yourself. That's the first thing. Second, if that's what traditional Chinese medicine believes, let them. They have a system of medicine, and it's worked for many thousand years. It's not the golden solution to anything. The Ayurvedic system is 7,000 years old. That's what they believe, a different system on the chakra system. Allopathic is a system. Homeopathic is a system. Herbalism is a system. They're just different systems. If we try and adopt it from one to another, we're going to end up getting confused. What do we do at CPH? We use the tools that enable us to understand the patient without the paradigms that lock us in to them tools. So we use the 5 elements to observe the organs, and I believe that. If you don't believe it, you get a patient with aggravation, the time will tell you that they've got an issue there. Do I subscribe to their philosophies? No. I'm a practitioner. I want to use it practically. So that's the only thing I'd say on this. Let's not get off topic too much with it. Is that okay?
Som, it's Claire. Can I just really briefly reply to that question about the Jing and the Qi?
Sure.
So just from really what I briefly understand, the Jing is like the spirit or the soul that we come with, but the Qi is the life energy, and we can build the Qi by all of the things we've talked about today, the homeopathy, the remedies, through the food, the air, the water, being in nature. So I think the Jing is what we have, but it's the Qi that we can definitely cultivate in many different ways, and the Qi then supports the Jing. It's not like a finite thing.
Yeah.
Thank you.
If you take the step back, energy, this is all to do with energy. Jing, Qi, chakra, it's energy. Energy is infinite. It's literally that simple. So is life. Life is infinite. Doesn't matter what religious philosophy you subscribe to. I don't need to believe in gravity. If I jump out my window, I'm going to fall down, not up. I don't need to be a believer. It's just true. So that's simple as that. So let's get off that topic. I want to close this case down for Sharon. Sharon, are you okay with that?
Yes, thank you.
Because we're going to move on to the next case, but it's a very important point. It's quite nice how this works out, because we're talking about life. We're talking about Sharon's mum, and we're going to help her as much as we can. Great. Some of us, if you started treating patients, are going to lose patients along the way. Even homeopathy doesn't bring back the dead. And yes, we have a remedy called Carbo-Veg, which is known as the corpse reviver. It's literally not going to raise the dead, but if you're feeling like death, it certainly helps. So we're going to deal with cancer patients. We're going to deal with lupus or MS patients, you know, with Alzheimer's patients, dementia, and we're going to lose a few along the way. That is not a failure of homeopathy. It's definitely not a failure of us as a practitioner, nor should we ever feel that way. But when we're in the caring profession, we get emotionally involved with our patients. It's not right, it's not wrong, it's just the nature of the people we are. So we can't help feeling a bit sad, and I wish there was something more I could have done when we lose a patient. What we've got to understand is sometimes the patient's vital force is so low that the best thing we can do is help them on their journey towards death from this life. And there are remedies for that. And the esoteric remedies, the meditative provings, really help greatly to help us transition from this life to the afterlife or to death, whatever words we describe in the beliefs that we have. But we do lose patients. Sometimes the patient's soul is on its own journey and it wants to go. And it needs to suffer or it needs to die in its sleep. And that is not a reflection on us or our homeopathy. We spoke to a student this week and we lost one of our patients. It's a part of life. I lost my mother. I looked after her in the house with her. So you can't save someone else's life, nor are we actually responsible for their life. We can only do the best we can and let their vital force do its job. That's as far as we go. We stimulate their vital force as best as we can. But if it's decided it needs to go, it needs to depart and go on to its eternal life, so be it. That allows us to detach, to forgive ourselves, to say, actually, I'm part of the process, but I'm not responsible for the process. Same here now with Sharon's mum, to bring it back in. We're not responsible for her health. Things have happened in her life, but we can actually support her as best as we can with the combined knowledge that we have. So that's just as an aside of the events that happened this week. It's very important for us to remember that. Otherwise, we'd give up, we'd feel sad, and we'd never carry on to another patient if we lost one. That's not how it works. Death is inevitable, it's just a matter of time. It's how we live that's more important. Anyway, I'll stop the philosophy. Let me get a glass of water. It's right here. Next person on is Randiraj. Are you online, Randiraj?
Yes, I'm here.
Right. Floor's yours.
Okay. All right. So we've got, this is Jay, we'll call her Jay today. She's very timid, nervous, and of a quiet disposition. She's small framed, speaks slowly, and she listens very intently. She currently appears to me very tired, worn out, and she appears to be putting on a very brave face because she's got a lot happening in her life. She's admitting that she's feeling quite angry with her body at the moment and her current health situation. This is her own words on the mental emotional. And she says, I was diagnosed with breast cancer back in November. I was told just over a month ago that it had metastasized further to my spine, hip, bones, and liver. This has left me regularly overthinking things, especially when I'm experiencing pain, the fear, and overwhelms creeping in. So they were her words yesterday to me. Currently, she's saying that she's experiencing shooting pains all over her breast. In the last couple of days, her boob has sort of shrunk. It's pulled outwards and towards the chest. This is her left breast and the chest wall and the armpit. I have painful lumps behind my enlarged, sensitive, inverted nipple. There is multiple smaller lumps surrounding the larger tumour. There is a gathering of wrinkled skin halfway across the boob that has got 2 little black scabs.
Which boob, left or right?
Left.
Okay.
Yeah. So this is yesterday. She said to me yesterday, her main tumour feels like it's moved behind the main tumour. So what she's saying, she's kind of got a big, because her breast was feeling like it was rock hard before. And she's saying that she feels like there's something behind the actual nipple itself. This was the inverted nipple, which is changing. She's waking during the night, and that suggests there's gallbladder. Gallbladder obviously is overworking, and she's unable to assimilate her nutrition. She is taking her tissue salts, and she's got a lot of inflammation. Physical general, she's currently experiencing pain in her right hip. She's experiencing right shoulder blade pain and her left breast. I did speak to her again yesterday, and she actually said to me she felt there was also something in her right breast, but she hadn't told me that until when I spoke to her yesterday. She's also feeling more intense pain in her back, and she's feeling it in her vertebra. I've already talked about the right hip. It's quite intense at the moment. She's not on any medication. She's totally self-administering everything, and she's working with me for organ support, and we started her remedies homeopathically about a month ago. So this is somebody who has worked with me from November as a naturopathic nutrition client, and I've moved her over to homeopathy since taking on the case for that as well. So in terms of her current supplements, she's taking CBD. She's just begun THC. It says 1 drop, it's not, it's actually 1 grain. She's begun that in the last 3 weeks. She was already taking CBD. She takes frankincense, 1 drop just to the roof of her mouth each day. She's following part of Gerson and part of Budwick as part of my protocol with her. She's using flaxseed because it's very hydrating and kind of supportive to the body. She's using organic raw milk, ratio of 2 to 1 for that daily. She's got milk thistle for support. She's also taking Foti for her kidney, and she's up that 3 times a day. She elects to take infrared light. She's using that herself, not prescribed by me or suggested by me. She's decided to do that herself. She's taking curcumin. She's up to increase. She takes 3 capsules 3 times a day. She takes up to 1,000 milligrams of magnesium. She's also got probiotic daily. So you can see she's got a big regime. She used to have IV-C, which is an IV drip of vitamin C, and she took that exclusively between November and June, and she stopped that about a month ago when we'll come on to that shortly. She was taking MSM, and in her recent kinesiology appointment, it confirmed that she didn't need to take that anymore. She had a good standard of MSM in her system, and that's that part of it.
Okay, what it is, Randy, you had so much information, I had to copy and paste it into 3 different slides, okay? Which is why your timeline is blank. We'll come to that in a minute. Because there's a lot to go at here, why don't we just open this slide up as it is, because there's so much here that's jumping out the page.
Okay.
So open the floor to anyone. Questions, comments, observations, please. What are we making so far of this patient? She's 31 years old.
Hi, Som. This is Veronica.
Hi, Veronica.
Hi. I would like to ask, I don't know, maybe it's in the timeline. I actually have some questions about her. Does she have children? What are her about her relationships?
Let's hold that for a second.
Okay.
Because what I want us to get into, part of the clinics is, what can we glean from the information we see? Yes, there's more information on another slide, because sometimes we get overburdened with information and we get lost. Sometimes we've got so much to go on just on one slide. So a very, very important point, Veronica. We will come to on the second slide. My question for us all in the audience is, what can we ascertain, determine, or what's this leading to, that just looking at this information on this picture as it stands at the moment, before we go to the next slide?
It's Claire here.
Hi, Claire.
Hi, it just seems that she's very, very proactive, and she's really taking things into her own hands, and she's looking for a lot of help.
Okay, good. Now we've got,
sorry.
Hi, Veronica, fire away.
The fact I also noticed that, but maybe this also could indicate, like, of course, a personality that wants to do all by herself, doesn't accept help. Yes, because usually when people are sick, especially cancer, we should let also somebody else take care of us. And it seems like she has been done a lot of research. She has Randy Raj support, yeah, but she has a lot of initiative and is following many things together, right?
Okay,
And for example, there's some things here that which caught my attention really is on the diet. I don't know what diet is she's doing. Okay, she's doing Gerson, but she drinks milk.
Yes.
Which
okay.
for the breast cancer is not good. Yeah,
Correct.
it's something
Correct.
that really aggravates, right?
Yes.
Hi, sorry, it's Claire Kay. I just wanted to say that I'm just doing this off the top of my head, but I think isn't the breast about love, and so therefore lack of love, and the left side of the body would obviously be to do with the past.
Yes.
So whether there's something going on there.
Isn't that interesting? You see, this is why I love this, doing it this way. You're absolutely right there, because if we're given the timeline, we're told. When we get so good at knowing homeopathy, we can actually paint the patient picture just on this information, and you'll find that you're more right than you are wrong. And that's why we pause for this kind of slide before we get to the next slide. Very great observation there, Claire. Well, hello. Hi, Mariana.
Hello. Can I also chip in? It strikes me as if she is putting up a brave face, but actually there is a conflict between how she appears to the world and how she feels herself inside. So that is the typical cancer behavior. you would like to.
No, it's good.
It'd like to be appearing good, and I think it's fine, but deep down you're angry with your body, but actually you're not angry with your body, you're angry with your mother and somebody said already past life, past love on the left hand side as well.
Now, you're absolutely right. So the first thing, the thing that jumps out of us, we've got a patient of 31 with cancer. Without anything else, module 2 in every course that we teach, what myosome is active here? The cancer myosome, straight off the bat. She's in an active, inherited. I'll put my little laser. Correct. So this is what she's in already. So so here we've got lung cancer. We've got, I don't know what FGF lung cancer means, but we've got
maternal grandfather.
Ah, right. Maternal grandmother, maternal grandfather. So we've got cancer on both sides of our mothers. So she's got an inherited cancer myosome, which is now active. We've got here, okay, so we've got that here. We've also got a syphilitic destructive place here with cannabis use and dependency here, okay, and depression. And then we've got alcoholic dependence. So we've got syphilitic and cancer myosomes in this patient. No wonder the hips are starting to go. There's some syphilitic going on. She's 31. Describe her height, weight, looks-wise as well. This is always very important constitutionally.
Yeah, she's about 5'6". She's of slim build. She's very slight framed, and she is of dual heritage. She's of
mixed race,
from the Caribbean and UK.
Okay, right, okay. You've described here she's tired, nervous, and quiet disposition. Right, I'm going to open this to the floor. Just on that alone, not that there is a remedy, but do any remedies come to mind when we hear things like this? Just throw them on the webinar, people.
Lycopodium.
Lycopodium. Thanks, Kalyani. Anything else come to mind?
Pulsatilla.
Pulsatilla. Thank you, Karina.
Nux vomica for the liver.
Nux vomica. Okay. Potentially, they're normally quite angry people, but okay. Thanks, Roger. So just that first line alone, we're thinking, right, that's telling us there. Small frame, speaks slowly. Appears tired and worn out. I'm not surprised if she's got cancer. How long has she had cancer? She says back in November. So this is a fairly recent thing for her.
Well,
okay,
when you look sorry, excuse me, Sam. When you look at the timeline, it's not.
Right. Okay. So it says diagnosed with breast cancer back in November.
Yeah, that's when she had when she was diagnosed again.
Yes, again. So it's the second time then.
Yeah.
Right. Okay. See, because okay, that's fine. And now it's metastasized to her spine, hip bones, and liver. Okay.
Yeah, that was in June.
So she's in a severely cancer miasmatic state.
Yeah.
The cancer is actually overtaking this young girl, well, 31, she's a young lady's body at such a young age. The cancer's taken over her. There's not much left for her. She's small and timid. The cancer is also going to be sucking up all the energy. And yeah, I agree. The milk just turns to casein and sugar, doesn't it? Milk sugar. So that would be the first thing that needs to go on her diet. Absolute no-no for cancer. Normally we say fish, flesh, fowl, and dairy off the table, straight away to cancer. straight away. Is
May
one
I
of the,
say? May I ask something? Sorry.
yes, Karina?
Because we were talking here about the milk and the flaxseed. I don't know if Hadiraj, sorry, Randiraj. I don't know if you know this, because there is a protocol which you mix the, I think it's the Gerson, I'm not sure.
It's Budwick. It's Budwick. That's what she's doing. She's doing Budwick.
But normally you should have to mix the flaxseed oil with a cottage-like cheese, not milk.
Yeah, it's quark. Yeah.
So is she doing this because of that?
Yes.
But I believe, I'm not, you can correct me, I believe that the effect of doing it with milk rather than the cottage cheese, it's different.
I know it is. I've given her that protocol, but she's chosen to do this.
Okay.
Right. I think let me just take this off the table for everybody. This patient is nothing to do with the diet at all. And we'll come to that in a minute why. That's a bold statement for me to make, because I know we harp on about diet is the cornerstone of everything. Yes, it is. But when we deal with this, we'll read why in a moment. She's overthinking and blah, blah, blah. She's got shooting pains all over her breast. Fine. So everything's tied up in the breast at the moment. We know where the energy is. Where's the energy tied up right now? It's here. What's caused it? Cancer cells will become active. The timeline will tell us how and why. We'll come to in a minute. There's some things that jump out here. The tumor feels like it's moved behind the main tumor. So we know there's a lot of destruction going on. The cancer's active in the body. It's proliferating. She's waking up 12 twin, and you said she's got the gallbladder. That's the yang energy. Too much yang.
Gallbladder time. Yeah.
So if that's the gallbladder time, 11 till 1, then 1 till 3 is the liver. And this is the key here, ladies and gentlemen, she's unable to assimilate the nutrition. So if we just pause and worry on that for a minute, if she's unable to assimilate, it doesn't matter how good the nutrition is, it's not going into her body. Simple fact. So the body's telling her, it's telling us what she is able and unable to do. This is theory. This is great. It's actually a wonderful, wonderful nutritional program, to be fair. Can't fault it at all. But her body can't use it. So we're not critiquing this. We're not defending it. It's a great product, but she can't take it. It's like me asking someone to jump who's got no legs. What's the point? However, the gallbladder, it also tells us that the bile is not being produced, unable to assimilate fats as well. Yeah. And there's a major remedy that affects the gallbladder for thiamine people. Pulsatilla is almost specific here. It doesn't mean it is the remedy in this case. But when we can look at the case this way, we've got to allow remedies to flag up in our mind and then say, well, is it or isn't it, and discount it. But that's what we're getting trained to. We don't just go blindly down one alleyway either. We just think, well, let it come. And how does it fit with everything else that we're going to learn on the next slide? But pulsatilla affects the gallbladder. I'm sure Ellen mentioned that on webinar 2 or 3 on her digestive system and went through the parts as well. And if you just read it in your Materia Medica, it will tell you unable to assimilate fats. That's a pulsatilla keynote of that remedy. There are other remedies as well, berberis, etc., milk thistle. There's quite a lot of them there. But that's something just to be aware of. And because you've written it on the notes, it kind of jumps out the page right there. So well done on that observation. Shall we go on to the next slide?
Okay.
Just going to pause. Anybody else got comments on this slide alone? No? Okay, I'll move on. Over to you again.
Can I just add one more thing?
Sure.
Which is that she actually feels that she has been carrying her mother all her life. So I've had to unpack some of that. Her mum has been very unable. Her mum's not very been present. Her mum has not.
So when you say carrying her, do you mean like looking after her?
Yeah, she's been her mother's carer, basically. She's been mothering her mother.
And what's the thing we know about the cancer myosome? Yeah. It's often called carer syndrome, isn't it?
Yeah.
So that also comes to mind as well.
Say again?
Natmer comes to mind with the absence of mothering as well.
Yes, and that garbage with the father. Well done. That's a brilliant one. So yes. So now let's see what the timeline shows. And this is why I did it on another slide, Randiraj, because it was, for me, way too much information, but we'll go through it. Okay. It's not criticism. Look at that.
Okay.
Over to you.
Okay, so this is the timeline. So usual vaccines and childhood illnesses is up to the age of 10. She was at home for that time, and then she was living in a home where her mum was kind of dependent on what you've seen already in relation to her kind of cannabis use, her father's alcohol use, and they didn't appear to have she doesn't appear to have a very stable relationship. She's felt loved by her grandmother. Grandmother was a key figure, which is in the timeline anyway. But she was in that home, and she looked forward to holidays with her grandmother and having that time because she felt very nurtured and loved there. So 18 to 22, she left home. She studied fashion. She was in London. She at 20 was in a key relationship which was significant. She discussed and described how she hadn't really loved herself enough, and at that time she also felt the need to have a silicone implant. So she felt a lot of insecurity, and her then partner paid for her implants. And she described at that point she'd had the implants that she felt better. And she also had a course of antibiotics, which were about 6 weeks to follow the surgery to help her recovery.
Just pause there a second. Let's just focus on that line in her 20s. She's seeking more love, more self-love. So she's not happy with herself. This is the person who's not happy with herself. Right, she's got her own thing. She felt that one breast was bigger than the other. Okay, that's fine. And that made her feel insecure. Partner paid for the silicone breast implant. And that could be a number of things. Is it because she wanted them, or he wanted her to have them? Or he just had the money which she had the want?
She wanted them. Yeah,
right,
she
okay.
wanted them, and he supported her to have
So he acted in a supportive way to say, look, I support you if that's what you feel, rather than saying, oh God, you look ugly, fix yourself.
Yeah.
Because they could be taken a couple of ways, couldn't it really?
Mm.
Okay, because the next thing that happened the year after, isn't that interesting?
Yeah, is still friends with this person, but she arrived at the point where she decided she didn't really love him, and she didn't want the physical relationship because she didn't feel he wanted to experiment sexually the way she wanted to, and she felt it was more like a friendship, and she didn't want that. So she broke up with him, and then she met her current partner, who's called Reese, and they've been together for 11 years. She worked in a particular environment. So she worked in a psychic shop, so she calls it a psychic shop. I think it's a spiritual kind of shop. And she worked there for 6 years. So with her current partner, Reese, she had an abortion. She didn't feel she was ready, and he wasn't ready to be parent. They weren't ready to be parents, so that she elected to have termination.
How does she feel about that?
She said she's reconciled. It wasn't the right time, and it felt it was the decision she made, and they both came to that agreement.
Right, because when we take a timeline, patients will give us events, which is absolutely fine. So all we've got here is actually a list of events with her. Until we know how it impacted her, what she thought about it, what she felt about it, we don't know the real impact of it. You see what I mean? So because she might have had a termination for various reasons, no judgment on it whatsoever. The only thing that matters is how did it affect her?
She was happy. She's reconciled. She said what she'd said to me was that she didn't feel it was the right time, and it was her choice.
Okay.
And Reese supported her choice. And then after that, after that pregnancy, she 6 months later had another pregnancy. Through using the cap, because she's always been very natural, wanting to use natural methods, and she used the cap, and then they decided again. She said herself that she didn't want this. She wasn't ready for a family, and her partner agreed with her. So after that, she decided to use the basal temperature method, and she used that exclusively.
Okay.
So she talked about her mum again. She put that in her timeline. Her mum fractured her ankle. It was very traumatic. She said very traumatic for us all. They're her words. And then she did it again a year later, after they found out her father had been having an affair. And then she actually said, "Mum, totally, she's lost the plot. She was losing the plot. And from this point, I decided I would always be on my own person, not rely on a man to control my life." So it's quite a bold statement she made, and they were again her words. She talked about a very key holiday she had in Hawaii, where she met this woman. She talked about her, and she felt a lot of emotions, and she felt very jealous, and a lot of she was quite upset because this woman was a lot of things, and also she noticed that she was kind of flirting with Reese, and then she discovered at that point, she made this, and I put it in bold: no one can love you more than yourself. So she made that statement herself, and she had a sense of creating something for herself. So she felt she wanted to have something for herself and not be in the shadow of her partner. He's very gregarious, very extrovert. She's still in love with him. She's kind of beside, she's very committed to him, but she made a decision she wanted to do things for herself. And she said that she felt very emotionally upset at that point about the event, and it made her arrive at a point of really thinking about her self-love, and it was a bit of a wake-up call, and she wanted to then work with her own divine energy, her own feminine energy. And shortly after that, she found a pea-like lump in her left breast, and the hospital said it was a fibroid, and she began to take care of herself a little bit better, took supplements and eating a little bit better. She had a biopsy in the same year, and it had changed in size from a pea to a walnut. So this is 5 years ago. And then she noticed that the lump was getting bigger, and she began celery juicing. And then she had some alternative therapy. She went to acupuncture, and she began to look into how to take care of herself and her breast health. And she began taking maca tea, and she took evening primrose oil. I think that was her exclusive protocol at that point. And then she began to think about her own kind of life force and what she wanted in her life, and she began to make jewelry. She was making malas, and then she began her own business a couple of years later, which is called Yoniverse. It's a crystal shop. And then in 2019 she had a biopsy after a mammogram, and that's when she was told there was a tumour, an active tumour. That's when she came to see me, and at the same point she was also pregnant. She was 8 weeks pregnant at the time, and she was thinking very carefully about what decision she wanted to make, and at that point she wanted to keep the baby.
Is this with the same partner, Reese?
Yeah, with Reese, yeah. And then at 11 weeks she had a miscarriage, and she was quite upset about it all, and again, she was kind of dealing with a lot of different things at that point. And sorry, that little bit, that's not from there. The stiffness of the vertebrae in the last few days. This is after. So in November, her breast tumour was 27 millimetres, and it was grade 3 invasion. And it also was in the lymph node. So it's estrogen receptive 7, progesterone receptive 7, and it's ER derivative. So it's a hormone derivative. She had an ultrasound in February, and it had grown to 36 millimetres. She had an ultrasound in June, and it showed that it had spread to the liver. And what it says on the letter is that the liver has biomastitis. There's 6 lesions in the liver. She's got bone disease, predominantly in the spine, and it says multiple levels. And that's now she's experiencing bone pain in her right hip and her right shoulder through a shoulder blade. And yesterday she told me that she can't stand for very long, and she's now using crutches.
Okay.
Can I ask a question? Does she still have the implants in?
Yes.
Okay.
Right. Lots
Hi,
to go
can
at
I
here,
just-
people. Let's open it up. Yes, Heidi.
Just talking about the breast implants, that would mean quite a lot of heavy metal toxicity, specifically platinum. So just thinking that could be an issue.
Okay.
Sorry.
Oh, I didn't say, excuse me, sorry. She actually has taken amalgam fillings out, but that's not on the timeline. I know she had that done.
Now,
January.
can somebody look up on the MapMed for me, please? My brain's not working today. is platinum listed as platinum in the Materia Medica or as platina? We'll just come to somebody can chirp in with that in a bit. Let's get some more discussion around this, please. Sorry, Francesca.
Yeah, it's Francesca here. Hi, everyone. Rangeras, this is such a wonderful case. Thank you so much for bringing it to clinic. On the first slide, I had carcinosin screaming at me as a remedy. The disclosure by Rangeras towards the end of that discussion had me thinking lacumanon, for lack of mother's love.
Yep.
Looking at the timeline, I now find myself with a question with regards to the miasm. To me, I'm wondering about destructiveness. Yes. And whether this would be a syphilitic miasm.
Mm-hmm.
So it's kind of changing where I'm thinking at, but I'm also seeing a lot of grief along with the sense of feelings of lack of self-worth and love. With the first slide, I thought this lady might be controlling.
Yes,
and
agreed.
Very furious that she's losing control of her life as she may perceive it as being. A cancer diagnosis would further enforce kind of possible loss of control, although I can see from what Rangeras is presenting that she's trying desperately to regain control of her life by taking charge of her own health. So I don't have a clear thing. The lacumanon came up very clearly. Carcinosin came up very clearly as two possible remedies. But quite possibly she's also very under-resourced minerally.
But as we've just found out from that slide, because she's unable to assimilate nutrition.
Exactly, Himalayan sole.
Yes.
Okay. That's as far as I've got.
Okay, brilliant, Francesca.
Platinum metallicum.
Say again?
Platinum metallicum.
It says platinum, not platina.
Platinum metallicum.
It says both. It's platinum metallicum, platina metal.
Yeah.
Right. So it's the same remedy in the Materia Medica, is it?
Yeah.
Okay. For some reason, I don't know why, it's just come up to me when you talked about this partner sexually, and I thought of platina. Because platina are overly sexualized people, aren't they? If I remember correctly, it might be a keynote in the Materia Medica.
Right.
If it's not, I'm mistaken. It's highest, but
it says sexual mania.
There you go. I'm not saying she's a sexual maniac.
No.
Right?
It's important to know.
But it's very important. See, this is what I'm saying. Sometimes, right, we it's not looking through with a fine-tooth comb, not at all. But like, and this is why I love these clinics so much. We all, because we come from a different perspective, we're picking up different things, and our collective wisdom is brilliant. Because on this slide, what jumped out at me was the gallbladder and enable to assimilate. And what jumped out at me here was this bit here with the experiment sexually, and I thought platina, and I think I can't remember. I think Heidi just said was it or somebody who talked about the platinum in the implants.
Yeah.
Isn't that interesting?
Yeah. Well, Som, I didn't get this full timeline from. I didn't get it from Jess until yesterday.
That's
fully.
okay.
I've been waiting for her to give it to me fully, and I haven't. She's been very well. There's a lot going on for her, isn't there?
But what this is the important thing to remember. Please, ladies and gentlemen, you never ever have to justify or defend your own case, because if you did everything in one prescription and one meeting, there's no need for a follow-up, is there? The whole point is to learn more as we meet them more and more. So that's not a problem, and that's actually to be expected. Which is why we're not looking for this silver bullet every time we write a prescription either. We expect to get it wrong more times than we get it right, but we expect to move the patient along to a system towards health, which is why they're called patients, not clients, because you need patients to get well. It takes time, simply put. But so these things, and this is why I love Francesca's comment. Let things jump out at you. It's a great way to be a homeopath that way, because it also, there's lacumanon, there's napmure here, there's self-love, there's low self-worth, which is your lycopodium pulsatilla. There's the timidity, the shyness here. But there's a little bit of manipulation going on, because I've got this fella, I had a bit of insecurity, he paid for me, now off you go, because you said he's been with the guy for 11 years. I don't want to point any fingers, but there might have been a bit of an overlap between the other fella. But anyway, it doesn't matter. But something I'm more interested in, she was 20, She was seeking more self-love. You're
Mm.
20. Where the hell did you not get your self-love in your teens? Was it from the parents? Because what I'd like to explore further with her at a follow-up is to say, what happened before 20? What makes someone at the age of 20 need more love? Because you're normally at home until 17, 18, 19 anyway, till you go to uni or work. So that is probably the pre-20 years is probably worth exploring at the next follow-up.
Well, I can actually tell you, because I've done some other work with her anyway. I've done healing work with her as well. So when she was 11, her grandmother passed away. She was very key to her in her life. And that her mum totally lost the plot as well, because her mum was very dependent on her grandmother too. And what Jess says that her grandmother was like her mother. She was her mother.
So we've got elements from grief here.
Yeah, we have.
Has she mentioned any resentments towards her father? Because, you know, if she mentioned he's an alcoholic and he doesn't seem very present in supporting the mum or herself. It seems as if she's taken on his role.
Yeah, he left the family home and he was having an affair and she's reconciling her relationship with him. So again, we've been doing some work on that, reconciling her feelings with that. So she's working on her grief and also her anger and her resentment. So she's been doing some work on that.
Okay.
Yeah. Okay. Well, isn't that interesting? Because as Francesca said, she's quite right. This lady has got 2 active miasms, cancer and syphilitic. And cancer sits on top of all of them because all roads ultimately lead to cancer.
Yeah.
She's destroying herself while she's got cancer. She's got the cancer first, and now the body's decided to destroy itself further, as well as the cancer manifesting in other areas, such as liver. Why she got cancer of the liver? Because that's where she's storing her anger.
Okay.
Let me just get out of this. I love this. This is where the 5 elements comes in. And Karina, we're not going to go into the theory of Chinese medicine, but we're going to use it as an observational tool. But it's brilliant that you said it, because look at this. We've got cancer on liver, and here's our gallbladder time. Tendons and joints, opening the eyes, emotional anger. She's an angry woman, and yet the outside external picture is timid. Inside, there's a lot of rage and resentment. So isn't that interesting? Because what do we say? The body never lies. We can go wrong in our interpretation of a case. We can even get the diagnosis wrong. We can even get the prescription wrong. But the body's never wrong, is it? The body's always right. That the disease is the dialogue of the body. It's telling us what's happening to this patient. Our challenge is to say, where are we placing the most emphasis? What needs curing right now? Not can we cure it, can we cure it now? So that's the challenge for us. But this observation tool helps us understand what's going on. And look what we had here. If we follow the destructive path in red, we had grief first. She's had elements from grief from the grandmother dying, turned to a lot of suppressed anger. She's over here in the cancer state, not feeling worthy, can't digest life, can't digest my fats. Now, isn't that interesting? And lycopodium is an insecure, timid, shy, angry, controlling, manipulative person. I'm not saying it ticks all the boxes, but bloody hell, there's a bit of a picture going on there.
Yeah.
And there are so many remedies, which is also why we don't do classical prescribing with one script. We combine. So let's just go on to, I think there's a 3rd slide for you, Randy. Right?
Yeah,
so
there is, sorry.
Let's just leave it on this one for now. Just open up any more comments or observations on this timeline, people?
Yes, I would like.
Sorry, Kalyani. Go on, Kalyani, first.
Okay, so this person comes across to me as someone who rejects something that they desire. So she wants love and happiness, but she keeps rejecting it. So it's same with her food. She has got this all food regime, but her body is rejecting it. It could be because of the grief that she had, her grandma passing away, her mother not being there to support her, also her father. It's sort of breaking the trust, what happened between her father and mother. So maybe because of that, she has gone in a state where she desires something, she's obstinate, but then she rejects it. Very lycopodium, actually.
Yeah. She has a lot of walls up, I would think.
Yeah, I think that's right. Yeah, the walls are coming down slowly.
Okay, anything else on this?
Yeah, it's Veronica.
Hi, Veronica.
I noticed that, well, I was thinking on her timeline, what could have triggered. I was thinking, I was going to ask Randiraj if when she decided that she was going to love herself, in Hawaii, did she have a fight with with her boyfriend, or was it something that was very emotional and was it suppressed? Do you know? And
I think that well, if we're looking at the seeking more love, we know that's at 20, but at 25, what happened was she noticed her.
That was a trigger, like a wake up, because it feels like a wake up. Or
yeah, I think how I observed her conversation was that she observed somebody else. So she externalized her, she watched somebody else, another woman, and how she was exuding her feminine qualities and her love. And she saw that, and she felt that she needed to mirror and be more feminine, and also love herself more, to show herself more.
And I also realized that she has on her hips, problems on the hips, and hips are related to parents and are both hips, right?
Right.
Or so probably something is there also, and shoulders also are related to the parents. And yes, and the heart chakra is related to the way you see yourself, and to love, and the way you see yourself, and in your relationship to others. And all cancer situations, they are also very much related to the base chakra, which she also has some issues there, because she has had the abortions and everything. So that's just I thought that makes sense in all these things. Yeah. Very nice case, very interesting.
Okay. What we've got here as well, we must remember we've got an active cancer myosome, because the lump has grown and is manifesting in other parts of the body. So we can't lose sight of that fact that it's overtaking her body now. Yes, she's got some mental emotional issues. Yes, she's got a lot of, she needs to start loving herself, to be fair. And everything that's outward in her life is projecting and reflecting that back to her. The lady in Hawaii flirting with her boyfriend. Nothing wrong with the lady, nothing wrong with the boyfriend. It might have been, but if she doesn't love herself, she's going to experience things that show her that there's another example of him not loving her enough. Because if he did, he wouldn't be flirting with somebody else. So she's experiencing everything in her life. Everything in her life is an outward manifestation of how she's feeling within herself. She needs to work on that. But right now she can't, because now she's got a disease that potentially the prognosis doesn't look good if it proliferates. So that is our urgency here. Shall we go on to the next slide?
Okay.
Right. Over to you.
Okay, so my analysis is that she has a lot of fear of her past trauma, lack of self-love, hurt, indecision in her life, and moving forward. She hasn't always loved herself, and this has had an impact on her heart chakra. And she has talked about that quite a lot. So she, when I first started working with her, she took, I haven't put it in there, but she had taken rose quartz to kind of help open her heart chakra. So the method I'm using for her is totality. Cause effect, I've put most likely unresolved issues around separation from her husband. That's not right. It's not from her husband. Where's that come from? Just unresolved issues around her family and the trauma that she's experienced from childhood, and she's taken it all the way through her life. To some degree, I'm still holding on to it, because she's had very significant things you didn't get in the timeline about her. Her current situation where she wasn't able to have the child she wanted. That's been massive for her as well.
That's finally got to her, because first of all, she made a choice that I don't want a baby. Now her body's telling her, I'm not going to let you have a baby because I'm fighting cancer.
Yeah. And she was really upset about it when it happened. She was desperate to hold on to this baby. And she was talking, and she was looking at lots of different therapies and lots of different ways. She was thinking about going to South America, to Germany, to lots of different places.
So in her picture, what is her overriding theme for this patient, for this young 31-year-old lady?
She's trying to have control in her life.
Maternal love, receiving and giving for me.
Yeah. It's a lack of love and ailments from grief. They're the themes that are happening in here.
And now I don't think she's able to receive it or give it at the moment.
Yeah. And it's all to do with the heart chakra. And what's right on top of the heart chakra? The left breast. It's all tied up there. And there's also a thymus gland there. And what does a thymus gland do? That's stuck right behind our breastbone. Thymus gland is a #1 source of T cells. That's what they call T lymphocytes, thymus lymphocytes. It's part of our immune system. We talk about the spleen for cancer. We talk about the lymph nodes for cancer. Yes, there's going to be organ support with cenathus, but what I call in my head, spleenathus. But we need to open up the thymus gland, and maybe that could be a sarcode there, in addition to rose quartz, to open up a heart chakra.
Okay.
And what's a major grief remedy for the heart? Natrum murum, aurum muriaticum. What does aurum muriaticum do? Bones, cancer, etc. There's a lot of remedies there that we can use, and this case is pointing us towards these kind of remedies. Okay. So we're not going to pick up your prescription specifics here, because I think we've done a few charts. I think I did a different representation for you when I was trying to cut and paste these slides. I thought let's look at it with a fresh pair of eyes. But let's work through this at the moment, because it helps us think what we've come to, where we're headed, and where we need to go. It's a very, very good learn for us.
Okay, so in terms of her, when I was repertorising, is that what we meant to talk about? So in terms of her, my repertorisation looked at the breast and cancer, liver cancer, bone cancer, and then her grief, sorrow, general ailment, emotional and mental symptoms, her remorse, things of regret, and her weakness with the cancer. And then her prescription, this is her current prescription, so she's on this prescription.
But let's look at the remedies first at the moment, because let me just get the laser on. You've done quite well here with these. This is absolutely right too. You're thinking on the right lines, and you're totally right with the method you're using. It's not right, it's not wrong, it's a method, one of many we can use, and you're doing well here. It was well done. And out of that, these are the remedies that jump out.
Yeah.
And isn't it interesting that a lot of these people are talking about? Aurum, carcinosis, napmule.
Sorry, do you know with breast implants, is that an obstacle to cure or not? As a drug layer or not?
You know what, Sharon? I was going to ask something very similar, and I've got limited experience with them, or zero. I wonder if breast implants can be a cause of breast cancer.
Well, they are carcinogenic.
It will be, won't
Yeah.
it? It will be, because it's trauma to the breast.
Yeah,
Right.
they definitely can, and they are full of heavy metals, not just platinum.
So I've learned something
known
new.
to leak as well.
Right.
Yeah, they'll
so,
be leaching all the metals into her system.
Yeah.
Now,
yeah, that's true actually.
Right. So now let me put my homeopathic head on, because like I said, I've got very little to no knowledge of breast implants. So what I've just learned is they're put in, they're full of heavy metals, and they cause trauma. So if in my little simple head, there's ailments from trauma, things like arnica come to mind, and arnica is amazing for breast cancer, by the way, especially hard tumors. There are many others there, but I'm just giving you my bloke's perspective on what I've just learned from you ladies. And there's heavy metals. I did not know this. In my simple brain, I thought they were called silicone implants, because that would lead me to think towards silica. And silica helps with indurations and scar tissue and all that stuff as well. So that was where my head was thinking. But if we learn there's a heavy metal toxicity, then we need a heavy metal detox program. I'm thinking out loud here. And we need a chelation. I did not know this until we've just heard it right now. So that's just throwing it out onto the floor for us to digest, I suppose. Is there anything else that these do? I did not know that they leak either.
Yeah, there was a big scare about 10 years ago where for the first cohort of women had it, there was a big leak and a lot of people called back.
So when they leak, what do they leak? Fluid?
Yeah, and metal. I didn't, yeah.
So she's got a lot of heavy metal toxicity in her body then. I did not know this either. Wow. That might change a few things, will change the prescription that's needed. Okay. So we need to consider that when we look at revising this prescription, don't we?
Yeah.
Okay. So we've got the remedies. Sorry, Mariana.
And also, after a certain time, they can go smaller, they can shrink, and they can cause a deformity of the outlook of the breast. So the breast could appear wrinkly, and that is not helping the self-worth and the self.
Right.
You're doing it to become more attractive, but suddenly after a few years, and most probably, I don't know, that would be a question for me to this girl, as this implant has gone smaller, and how does she feel about if there is a wrinkles appearing, because that might bring back again the feelings of, oh my God, I did all that to become more attractive and to get more self-love, but now look at this, it goes back to zero.
You know what?
Yeah, that's an interesting point, because what she is seeing she's got an oncologist. The oncologist is wanting her to take their protocol. She doesn't want to do that.
Let's forget that for a minute. Let's focus on the patient. So we're not concerned with the allopaths at all, to be fair. Now she's come to us, so let's see what she's going to. Now that's interesting what you say, Mariana.
I was just thinking about in terms of the image, because I shared an image as well, didn't I?
Yeah, I didn't want to put that up on it, to be fair, because I thought let's just focus on this, because now if that is so, has the breast deflation caused this change in her structure, Randy Rice? Because it's not the breast just changing, like you said. That's in every time we talk, we learn something. Because if that's deflating, of course, it's in my head. I'm thinking like a balloon shriveling up. If that's causing that induration in her breast.
That hasn't happened. That's only happened in the last 4 weeks since she's been taking her remedies.
What, that induration?
Yeah.
So
because she's got quite a big tumour, hasn't she? And then the tissue around it's inflamed.
So, and it'll probably form scar tissue around it, and it'll harden up to protect itself.
Yeah.
Okay. So they're the active myosomes that's in her. But now, see, we've just learned so much about. Like I said, I'm probably going to have to read upon implants and see what they do to people, because they're going to be quite common in the future now. And if they're going to leach and heavy metals out there, we need to have some kind of strategy for that. Okay.
And
so,
can I just ask, sorry, it's Claire, can I just ask about if she's having the silica under Iraj, could the silica be kind of trying to expel the implants as a foreign body?
Yeah, I think she's got a little bit of scarring. She's got a little bit of scarring, and she's also got looks like she's got some we call them what do we call them? Like little what do you call that? Well, this, what would you call them? I can't say what's the English word? Like little I'm saying sat to you, Som. What is it called? What is it called? I can't remember.
What, a scar?
Nodules.
The actual, no, what she's got is she's got you can see there's leaching coming out. It looks like it's kind of coming out. So she's actually got a little
discharge.
There has probably been discharge, and then there's also the blood that's kind of circulating around it. So it's formed a scab. She's got scabs. She's got 2 scabs on her breast.
Oh. Right. Okay.
Could this be the action?
Sorry, can I ask also, is the implant still in?
Yes.
Right. Okay. Thank
Has
you.
she not considered, or the surgeons considered, to remove the implants at this stage?
I'll talk to her about that.
Because I think they're doing more harm than good, and they could end up killing her, to be fair.
Yeah, I would have thought she would have done that.
I think she's worried at the moment about giving her having any more trauma, because she's worried about what happened at the biopsy. So for herself, she's feeling that the biopsy caused the traumatic.
Well, the biopsy, you mean that confirmed the diagnosis?
Well, her words are that she thinks she doesn't really want to tamper with the breast anymore. Because she's scared, isn't she? So she's scared about it. So I'll have a conversation with her.
Okay. Okay. So
I think from a medical perspective, sorry, just a little bit of thinking, isn't it they first will take the implant out before they do perform a surgery, because that interferes with the actual surgery? That's why it was my previous question, is the implant still on?
Yeah, implant's still on. Yeah, and she's not planning on having any surgery.
Isn't this a very interesting case? Because yeah, we've dealt with cancer before, in breast cancer, and the go-to with surgeons is a mastectomy.
Well, that's what they've offered her.
Correct. So, because if not our approach, the allopath approaches will try and treat it, chemo, radio, blah blah blah, and now there's remedies that they'll give him as well, medicine. Sorry, and if they can't, end result is we're going to have to perform the surgery, right? Okay, but this lady is dead set against that. Now, isn't that interesting? Her own mindset is not the mastectomy is the solution, but she's got something in it that's potentially a cancer-causing element that could be the cause. But then, therefore, are we dealing with that as the obstacle to cure?
I think we are.
Because if that's the obstacle to cure, we're in I think the sad case to say, and I have to say it on the table straight away, we're kind of chasing our tail with this one. Because as long as that's there, can we really expect anything to get better? Because the obstacle is the cause, and the cause is the obstacle. I don't know. Am I seeing it too simply, or is that something that's glaring at us? Thinking, hang on a minute, this is the thing that's actually exacerbating the problem, and is also preventing us getting any better with it. Because the treatments, the remedies we're giving are correct.
Can I say, Som, that I told Jess that I was bringing her case to clinic today, and I'm going to talk to her later on today. And I said
Okay.
that we're
No,
showing
that's fine.
so
That's fine.
you'll
'Cause
be very encouraged to hear what's been said.
what we normally think is when indicated remedies fail to act, we say, look at the miasmatic, right? The underlying miasm. When that doesn't work, we say, well, what is the obstacle to cure? Because if you look at the remedies, doesn't matter what order you give them in, doesn't really matter what potency you give them in. The remedies are correct. So that's a bit of a stumbling block. And now, like I said, I totally did not know that they leach heavy metals, because there definitely has to be a heavy metal detox program here. There's a lot more that we can do as well in terms of remedies. And I think this is why I've done a bit of repetization. And we'll talk about other options in a minute. But just as a bog standard cancer patient, what we've got, your method here is bang on. The remedies that it's churned out are bang on. There's not much else more without knowing more information that we can do. But of course, we're going to do more. It's what we're here for. Any other comments on this, or shall we try and look at some rep results?
Yeah, so it's just Claire. I was just reflecting a little bit that we've said she's wants to use all of the natural methods and all the supplements and not the conventional surgery. Yet she's had the breast implant, which is obviously very kind of unnatural and heavily toxic, and perhaps there's hesitation about having it removed. So to me, it's fundamentally like that real self-image and self-love, because maybe she's not wanting to have it removed because of how the breast would end up looking, and the self-esteem's kind of linked into being attractive.
Yes.
I don't think it is.
Is it not that? No.
I think
Okay.
she's got a lot of fear. I think that she
Okay.
doesn't want anything to. I think she's been very scared of having anybody touching her breast because she's so scared of what's happening right now. So I think if she is, when I speak to her and kind of discuss, kind of the things we're saying, she'll make a different decision.
What you need to ask her directly, say, how important is your health and how important is the breast? You need to ask her some very direct questions to find out where she stands with this, because we can help, but sometimes we just have to stand by the side until she's decided. That's the reality of this case.
She'll be open, Sam. She'll be really open.
She needs to ask herself some tough questions like that, and say, well, what actually is going on with my body? What is the most important thing for me right now? Because she's in charge of her body. We're only going to support her in whatever decision she has. We're not here to judge her. We're not here to control her. But if she goes, no, I'm absolutely fine like this, then we say, well, what we can do is supportive. And then it changes the prescription. It changes the aim. Almost like when we have someone and we have to say, right, they're going to die. We have to give palliative care. We're not trying to cure them and bring them back to life. We're just trying to palliate them so their journey is easier. We don't know what's happening with this one. So there's some good questions to be asked with this patient to find out. Let's have a look at some remedies and then come back to this and try and see if we can modify the prescription somewhat. Yeah.
Okay.
Can I just ask a very quick question, Som?
Yes.
In a case such as this lady, would it be helpful or not to support the mitochondria?
Potentially. What's your thinking with that?
The cellular, the way that the cells are communicating.
Very good. And how do you suppose we do the mitochondria and support that?
I've no idea. That's why I'm asking you.
No, the cell salts would help there. Magnesium would help with that as well.
Yeah, I think some of the food's in there, isn't some?
So, because at the moment, this lady can't assimilate her food. So we have to find another way. Soleil comes to mind, tissue salts come to mind. But if a cancer is what we call aggressive, proliferating, growing, spreading, the vital force is telling us that's where the energy is tied up right now. And if we're not careful, it will overtake her. She's 31, but it's actually progressing. And from November to now, the last 6, 7, 8 months, this lump has grown from 27 to 36, and it's in a few other places and a few of the body systems. So this is actually overtaking her immune system now. That's the kind of picture or the trend, what we call the prognosis is heading that way. Let's look at this chart and then come back to it and say, well, how else can we help this patient? Now, cognition-wise, she's sorry.
Sorry, can I just say, I think the website that you need to look for like breast implant illness is literally breastimplantillness.com, if memory serves.
Heidi, would you mind putting that on our group for a bit later on?
No problem.
Thank you so much.
It lists all of the metals in silicon implants.
And there's something that we might need to chop out of that and incorporate into our lectures, into our lesson notes as well, then, if that's the case.
Yeah,
so,
definitely. We've treated about 6 or 7 women now with this breast implant illness in our clinic, and it's quite horrible.
So can you, when you say in your clinic, is that homeopathically or surgically?
It is homeopathically, yeah.
And so what are some of the methods that you're using?
It's all different for each one, but I'll look up our protocols and see what our breast implant basic protocol is, and I'll put it on the Ohana.
Okay, brilliant.
But
Thank
it's
you for that,
definitely chelation.
Chelation, yeah. Chelation will go to mind. We're going
And
to come
a lot of sulfur's definitely in there.
Yes.
I can't think off the top of my head. I'd have to go and check.
No problem.
Thank you. Okay.
So,
All right.
Thank you so much, Heidi. Yeah, we're going to come back to that, and we're going to modify this prescription later. Let's look at some remedies. Now, with a case like this, we could take the layers method, because there's a layer here. She's not on any drugs, so we take that off. There's an organ support method that's definitely needed because she's got cancer. We know that the organs are not doing their job to support the immune system, because that's what cancer is, isn't it, right? So we know there has to be a lot of organ support going on. Then underneath that, we've got the lesion layer, which is the layer of the disease. So these are some remedies, some rubrics that we can put down. We've got our general cancer, we've got our bone cancer, breast cancer, we've got the cancer as a myosome. Very few people use this. It's one of the exercises we do in lesson 2, or lesson 1, even hunt the rubrics, look at the myosome in each of the repertories. And very few people actually put that into the repertory selection. It's worth doing. It lets you know what comes up. We've got liver cancer going on, cancer of the breast with the pains. And these last 3 or 4 are the physical particulars. And if you look at it, they're less important, even though it's something like cancer. You've got induration of the breast, of the left breast. Now that's good to put in. It's not for the conium here, but look what we've got here, silica. And now I was a kid, I remember when people talking about breast implants in the 80s, I think they used to call them silicone implants, didn't they?
Yeah.
I don't know if the tissue or the materials changed, but so I'm thinking silica almost has to be in there. And in this case, isn't the silica going in as a tautopathic remedy?
Yeah.
It's just, correct me if I'm thinking this wrongly. Like I said, I'm so out of touch. I need to read up on, like I said, I didn't think it's a discussion I have today, but I need to learn that.
Well, we don't know what type she has even.
I didn't even know there was more than one type. This is what I'm saying. This is all new to me. So, you know, I need to go back and read this website that Heidi's on about. So yeah, if there are different types, we need to find out what's going on. And if they're leaking metals in her, bloody hell, we've got some chelation where it needed. That chelation bit is the easy bit, to be honest. Very easy. So that gives us hope. All I'm saying is I don't know what we're dealing with because I know nothing about breast implants. Once we do it, we can probably refer to this a bit later or defer it and pick it up on the Ohana group, because I think there's a lot of learns for today. That's fine. But now just on this lesion layer, all the remedies Randra that you're using are all here anyway.
Yeah.
So you can be rest assured that you're doing the right thing with the right approach, with the right remedies, you see.
Okay.
So that gives you the reassurance. But we think, what else is there that we could be looking at? And there's a remedy that's not on our prescription here. Okay, a couple of them. Conium is absolutely fantastic. Conium maculatum is for all things hard growths. It works brilliantly for breast cancers, and it also works brilliantly for prostate cancers and many, many other things. It's also been proved meditatively, and that's a whole different sphere it works in, because it works with drug addiction, etc., and crack cocaine addiction at an esoteric level. We're not dealing with that here. So conium is fantastic. But then when I think of conium, hard, stony growths, my simple brain goes to things like calc floor.
Yeah.
Something in calc floor needs to be in the mix. And this is why sometimes even the repertory is one thing. And we talk about this quite a lot, actually, affinities. What remedies have affinities for certain things? And calc floor, simple thing is it makes hard things soft and soft things hard. Like it's great for your teeth and enamel. But if you've got hard varicose veins and hard growths and fibroids, calc floor is a fantastic little remedy to have. So that would help to supplement conium. Serinum is here. Now, serinum is almost as specific for breast cancer. So serinum might be something to consider into the mix, and something called phytolacca or phytolacca, poke root. Now, those have done the cancer module, it will be in there as key cancer remedies.
Yeah.
So we can add these in. So these things, and another one, Asterias rubians or rubicans. I'm sure rubicans are a drink. Asterias rubens, I think it's called. Asterias, again for breast cancer, almost as specific. So we've got 3 or 4 very powerful, heavy-hitting remedies that perhaps we can add in here, okay? So we're going to come to that in a minute. Other stuff like Hecla lava, may or may not know. Hydrastis, brilliant. It's from Barbary, golden seal. Great as a herbal tincture, great for liver cancer, great for the spleen. So we've got 2 or 3 type of prescriptions we could come to. Let's deal with there's no drug layer, so let's use the layers method and work backwards. There's no drug detox layer, that's off the table. There's an organ support layer. So what kind of organs at this stage do you think we need to support? This is for everybody.
Liver.
Liver's one. Let's write this
Liver.
down, somebody. Liver's one. Anything else?
Heart.
Spleen.
Spleen. Anything else?
Heart.
Kidney.
Kidney. Anything else? I heard somebody else pipe up there. Sorry, I couldn't hear you correctly.
Heart.
Heart.
Yeah.
Potentially. What major glands by the heart?
Thymus gland.
Thymus gland.
Yep.
So we need to support the liver, the thymus, and the spleen are probably my little magic triangle here. More than anything else. So what kind of remedies are great herbal tinctures or even at a lower potency to give us the organ support that we need here?
Just to add here, the liver and spleen in Chinese, traditional Chinese medicine are linked to one another.
Yes.
Yeah. Yeah.
Chili. Oh, I can't say it. Is it Chelidonium?
Chelidonium, great liver remedy. Lycopodium is a great liver remedy. Nux vomica, hydrastis. Name me some good spleen remedies. Say again?
Cyanothus.
Cyanothus. As I call it, spleenathus. It's a simple one. It sounds exactly like the organ. Taraxacum. Taraxacum is great for the liver, kidneys. We need to be working on the spleen, definitely. So cyanothus is needed. We need to be working on the thymus. That's where the T lymphocytes are matured. T for thymus. So thymus gland is a sarcode. So if you're thinking your organ support, you're giving support to the organs, but also sarcode to help the organ work properly. So you could give in your cyanothus, your chelidonium, your nux, your hydrastis, and then give in your sarcode, spleen and thymus. That's a very powerful combo for the organ support there. I'm doing this off the top of my head, so I'm hoping someone's writing this down somewhere. So that's an option there for a prescription for the organ support there, Radhiraj, yeah?
Yeah, because I've got cyanosis and spleen in there and gallbladder. I didn't get the thymus, so I can think about that. How do I put the sarcode in then? What's that then? How do I
It's a rate. Did you get a rate for it?
Oh, so just put it from the
put it from the rate, yeah. To put that in there, okay?
Yeah.
Now, when we think of obstacle to cure, thinking back about what Heidi just said, we need to worry about this leakage, shall we call it? And there's a lot of unknown that I'm dealing with here, but my go-to for that chelation, for chelation therapy, this is where the super greens are absolutely brilliant. And I use it for Alzheimer's and heavy metal and aluminium detoxing a lot. And I use it for dental detoxing. And I use the chlorella spirulina moringa mix if you can get one.
Yeah, she's doing the green juice in the morning. That's her morning juice.
Okay, fine. You could also give it that way. Another great chelation from the Ayurvedic. I'm Indian by nature, by birth. So we use a lot of cilantro, coriander.
Yeah, she's got a lot.
Not just in the food, but often coriander seeds are great. Because the food, now here's the thing, Randiraj, and I'm going to say this directly to yourself, but to all of us as well. We've got a patient who can't assimilate her food.
Yeah.
So it doesn't matter what she's taking in her diet, not because the diet is wrong, not for me to be that way, but if she can't assimilate her food, her diet is almost irrelevant at this stage in her because she can't absorb from the diet. So we have to give it in another way. Does that make sense?
Yeah.
So even giving things like alfalfa, which will help to stimulate her appetite, would work, but if she can't absorb the nutrients, she can't absorb them. So on the nutritional side, when we said here any other recommendations, she needs Himalayan Soleil. She needs to rebalance all her minerals in. They make her hormones. We're doing a webinar on that in a few weeks' time. But the Himalayan salt, it will rehydrate the body and it will give the minerals as she needed. Now, I think everyone knows how to make Himalayan salt now. And if you don't, we can pick it up on the Ahana group and discuss it later for those that don't, or ask one of your colleagues. She needs that to nourish her body. She can't withdraw from the food she's taking because she's on a great diet, as we already know here. So we know that that is a limiting factor for us. So the chelation alone has to be either supplemental, if she could take it, or homeopathic or herbal. Because this is where we need to support the organs, because the organs can't actually suck the food and absorb it in the body.
Yeah.
Tom,
Yes.
can I also chip in? It's just an experience and something I've been reading about the Himalayan salt. You know, the salt rooms that started being really popular a couple of years ago in England.
Salt rooms, no, but go on.
Yeah. Yeah.
Salt treatment rooms. You go into.
Oh, sorry. I thought it was a room you just hang out with salt in it. Okay.
No, salt treatment rooms. They became popular about a few years ago. But my cultural background is in Mediterranean, so salt rooms have been used for ever since the Romans. So there are salt baths, and recently I went and had an experience again after so many years, and I think that will be very quicker because she will absorb through her skin.
Yep.
That will be quickly. We will reestablish that level. I think if she is prescribed that.
You know what, Marianne, that's a brilliant point actually, because that reminds me in the olden days we used to have magnesium salt baths, like Radox baths, even in the UK.
Yeah, we still do. I have it.
She has Epsom salt, but she can do the salt baths.
Epsom salts, that's the word.
Yeah.
Epsom salt baths.
Yeah, she does that already.
That's the word. So if she's doing that already and it's still not there, so that's telling us that's a major block inside her, you see. So if externally we're doing it, she's doing, so this patient nutritionally, supplementally is actually doing everything right, and yet we have this condition. And that's what I'm saying. So we know we've ticked them boxes. That's absolutely fantastic. But there needs to be there's something missing here. And it could be this chelation.
Yeah.
It could be
Hi,
obstacle to cure.
Som,
Hello.
it's Heidi again. Hi.
Hi, Heidi.
Just to say that we do a chelation support, not that I'm trying to flog product or anything, but it includes like calc carb, vitamin D, titanium clay, pre and prebiotics, plant-based enzymes, and I can give anybody any details for that if they ever want it.
You know what, that's absolutely brilliant. If you could, but also just naming what you've named, like platinum, titanium, we can make our own little mixture, can't you? In the process?
Yeah, exactly.
We can make a homeopathic chelation potency at something like a 6C or a 6X to do it on a very low and slow physical level and draw it out that way.
Yeah, definitely.
Because that's exactly what the superglues do. So in my brain, in my little pharmacy brain, my pharmacology brain, I'm thinking my tautopathic head, if we knew what elements are leached in or leached out of it, like things like titanium, platinum.
Yeah, I'm going to find out later. Just
exactly. So you give yourself that, you just find them out, look at the thing, and put them back in potency. You're done, and that will chelate it out the system. Simple as that.
I've just texted Jess, and she said she'll let me know later.
Fine. I think there's still me personally, I will be inclined to use silica there anyway. Silica helps with indurated breasts anyway. But if there's an element of silicone implant, she definitely needs that. It's not going to reject the implant, but silica also is a constituent of the cells. Now, Francesca mentioned about supporting the mitochondria. Silica is very, very important for the structural integrity of cell walls, which is why a lot of people in plants will put silica 6X into the plants that are wilting in the garden. It forms that cellulose of the cell wall. And if the skin's indurating there, the cellular structure, the structural integrity of the cells is not intact, and that's where silica is going to come in handy. So if you can't absorb nutrients, the suchless tissue salts again are going to be handy here. So that's the level we have to work in here on that layers level. So we've got the drug detox, which is the chelation. We've got the organ support. We've just talked about that now. And then we need to go into the lesion layer. And the lesion layer is where you've got these remedies now. You've got your conium, you've got your hydrastis, you've got your carcinosin, add in your serenum, asterius rubens, and your phytolacca. And if her vitality is strong, you can go in at 10 M2 3 times a day.
Yeah, she's on 10 the current
right.
Yeah.
So that's fine. So we know that, like I said, the remedies are more right than they're off. You're going to add in a few more heavy hitters to support that prescription. And this is what I'm saying. We don't just keep changing or going the remedies at what's going on. We relook at the case and we think, well, is there an obstacle to cure? And there might be this leakage thing going on, which is why the breast is changing shape. And while that's happening, all the time the cancer is able to grow because the remedies aren't able to do their effect.
Yeah.
I would actually take up totally off meat, fish, flesh, and fowl diet if possible.
Yeah.
And get it to go raw, juice, greens, etc.
Yeah, she's juicing a lot. She's actually drinking about 2.5 litres of juice.
Right now, the curcumin, the turmeric, 3 capsules 3 times a day. She wants to be on about 3,000 milligrams. So that's about 6 capsules, 2 capsules 3 times a day. That would help. Vitamin C, she needs to be on at least 3,000 milligrams of vitamin C a day. CBD drops, fantastic. Frankincense oil, 1 drop daily. You can do that 3 drops, 1 drop on the roof of the mouth 3 times a day. That's going in. If she can absorb that, that's absolutely brilliant. If the nutrition gets better, then we add in something like alfalfa to stimulate the appetite. There's no point in stimulating it if the nutrition's not working. Therefore, we want to think about supporting the gallbladder, and that's where things like hydrastis and Nexvomica help. Milk thistle will also help. If she's able to take milk thistle as an actual physical tincture, that would help.
She's taking that.
Perfect. Oh yeah, there she is. Support 1 time daily. Okay, so she's doing all these right things. The remedies are more right than they're off. I think it's that obstacle to cure. That's what.
Are we not considering probiotic here? I noticed she had 6 weeks of antibiotics at one point, didn't she? Oh, she has got it.
Yeah.
Oh, okay.
Her that was a long time ago when she had the.
So what we're seeing here is a case of saying, from a cancer point of view, it's not too difficult to treat. We've got the underlying issue of this patient, and that muir needs to go in, the ailments from grief. There's a lot of that here. But what we're seeing, so the remedies, like I said, they're more right than wrong. There's a clear obstacle to cure, and that would be the leakage that we did not know. Deal with that, and that will open up the pathway. The remedies can do their job. And if anything, the tumor should stabilize, then it should start regressing. That's the theory. But we have to keep on top of it if other things come to light.
Yeah.
And that's what we're saying. We're not looking for a panacea right now that we stay in it for a year and she'll be cured. No, we have to change this quite often as things will change in her, as you learn more information. But from now, we're at the case of remove the obstacles to cure. That's the situation with this patient. Everything else is more right than wrong. But add in the organ support. Is that okay?
Yeah.
Perfect. Thank you.
Thank you. That's amazing.
Any other questions, comments, or observations from everybody before we go on to the final case? No? Okay. Azrina, are you here?
Yes, I'm here.
Hi, Azrina. Welcome.
Hi, thanks.
Azrina's joining us from Trinidad, so she's 4 hours behind. That's why we put her last for the day. Right, Azrina, over to you.
So this patient is a 62-year-old woman. There's a lot of physical symptoms from speaking to her. She seemed very suppressed because I asked her about all her emotions, and the answer to the question, how do you feel? Do you feel this? She says no. So no fear, no sadness, no sorrow, no anxiety, and no happiness. She's a tall, medium-built woman, dark skin and complexion. And as I said, she doesn't seem happy. She doesn't smile too much. There was no eye contact while I was interviewing her. And she seems very, very closed in. Her presenting symptoms were left knee is swollen. With any movement, it's painful and nothing helps it. She had it back in February. She had the issue back in February, and it went for a while and it came back again about a week ago. She also, the x-rays showed that the fluids are drying out and the space is getting smaller between joints. The other issue she told me about was a soft lump in her neck on the left side. Now with the knee, it's her left knee. There's a soft lump on her neck on the left side of her neck, and it feels like it's hurting inside. She said behind the neck, inside of the head. She said that this lump, so about 16 years ago, she found some lumps in her breast, and she had surgery to have them removed. They were benign, but at that same time, she also noticed a small lump in her neck. And that lump has since grown, and that's the lump I'm referring to right now. It has grown and is now becoming painful. The left knee as well has been swollen for like about 20 years, she said, but it's now paining her. She's now getting pain from it. And now she is unable to walk and move with it. The third symptom she talked about was headaches on mornings, particularly, well, she says it's when she wakes up on mornings around 6 o'clock. She believes it's a sinus headache. She says, she thinks it's because of the dust. She lives very close to a main road. So she says that the dust builds up in the bedroom. And once she cleans, she vacuums, she cleans, she says she gets a slight ease, but in a couple of days when the dust builds back, she gets the headaches again. For me, what stood out was the headaches. came on around 6 a.m. She says it's usually sometimes between 3 and 4, but mostly around 6 a.m. She says when she goes out into her garden or her porch and she gets fresh air, she's fine, it goes, and she's okay for the day. The fourth symptom she talked about was pain in her rectum. This doesn't happen too often, but she did mention it, so it's something that is of concern to her, I'm sure. She says like every 3 months or so, she will be awakened by a pain in her rectum. She thinks it's hemorrhoids. She said she needs to walk around to get some ease from the pain, but then she'll get an urge to go to the toilet and she will have a bowel movement. And once that happens, the pain goes. Another symptom she presented with was a fiery, irritating, uncomfortable, as she described it, burning in her stomach. And it's worse with if she eats stale food, so food that's cooked for, that's not freshly cooked, affects her, and eating on evenings. She said it doesn't matter what time on evenings, and it doesn't matter really what she eats, it settles in her stomach. She feels like it doesn't digest. And the next day when she wakes up, she just feels it's there. So she has to sleep on a height. Her head has to be elevated when she sleeps. And the final symptom she talked about was having difficulty sleeping. She said she usually goes to bed, tired, sleepy, ready for bed. But then her mind just starts wandering. She starts thinking about different things. She didn't really pinpoint exactly what she's thinking about, but it's just all over the place. So she doesn't fall asleep actually until morning, 4 or 5 o'clock the next morning. As I said, emotionally, she seems very closed in because, I asked her specifically about these emotions and her answer was always, no, I don't feel happy. I don't feel sad. I don't feel grief. She did say, however, with her anger, she would sometimes quarrel. She would sometimes argue. But generally, when she gets angry, she just works it out in her head and forgets about it. Generally, she feels very hot and she perspires a lot, but it's very hot in Trinidad right now, unusually hot. So I was just wondering whether it's the heat or whether it's something to do with hormones. And, she's 62, she's way over menopause, but I was just thinking about that. She's very thirsty when it's hot. That could be normal, but I wanted to also look into that because she says even after drinking water, she still feels thirsty. But I noticed that she keeps drinking, she keeps putting a lot of ice in her cup, like filling it with ice. So that stood out for me. But she said to me, she does that because she doesn't like the taste of water. Of the water. I mean, it's filtered water. Nothing is wrong with the water, but she doesn't like the taste of it. So the physical particulars would be the left knee swollen and painful, and with fever. It's hot. The lump in her neck, left side, both knee and lump on left side of the body. The headaches on mornings. The fiery burning in her stomach. She also talked about heart racing. It doesn't matter. It's not while at rest, she doesn't have to exert herself to feel the heart racing. So she said she'll just stay still for a little bit until it stops and then continue doing whatever. If she's doing anything or if she's lying down, she just continues. And then the strong pain in her rectum, which is better with a bowel movement. She currently is on atenolol. Now, she's not hypertensive, but she had slight bouts of elevated pressure level, and the doctor put her on this saying that she's borderline hypertensive. So she doesn't take it every day, she takes it every other day. I don't know if that's a small dosage or not, but it's 25 milligrams. Okay. And from time to time, she takes omega-3 and B complex. She's not very consistent with it. She also has been inconsistent with, I've been telling her to take magnesium. So I have the carbs magnesium citrate, but again, she's not consistent with it. Okay. I, pretended I was a homeopath, full-blown homeopath, and I put her on Natmio.
You are a homeopath.
Okay, I am, but I thought I had enough experience to put her on Natmio 1M and Ignatia 10M. Now, I use these because these are the two that I have at home.
fine.
And for her stomach, I gave her Noxvam, a 30C. Now with the burning, I spoke with her, she told me about the burning, but she did say that about a week ago, now she's been taking these remedies for about a month. She did say about a week ago, the burning started easing. But, so, I mean, I want to think that the Noxvam helped. For me, I was wondering whether the potencies of the remedies were a little high. So I was wondering if that had any, because no, they're fine. Okay, okay, good.
We'll come to that in a minute, Asrina.
Okay, okay. Now the knee pain, the issues with her knee, she had it in February. It stopped. Now just before the lockdown, she was doing therapy. I think it was aqua therapy. I'm not sure. But with the lockdown, everything stopped. So she hasn't done anything for the knee. And then just suddenly it started back. It came back again in September. And she's unable to walk properly. It's swollen, it's painful. She believes it started when she is into gardening and landscaping and stuff, and she was doing her yard. And she believes it's by sitting on the foot in a particular position for too long. That's what she believes. I don't think so, but that's what she thinks.
Okay.
So she wants to just be able to go back into her garden and you know, so that's what she wants. She wants it to ease.
Interesting. Right.
Yeah.
We're going to go to the next slide in a minute, but there's so much that just jumps out, because on this first one, we don't even have to analyze the case here, but what I want to open it up to the floor again is there are some themes, there are some keynotes of certain particular remedies, because this is the whole point about a clinic, is to be able to see remedies that jump at us, because that's also a key skill to learn. Not just, the whole point of today shouldn't just be to end up with a prescription for a patient. If that's the case, we've missed the purpose of the last few hours. So what are we seeing, ladies and gentlemen, on this slide that's coming? What comes to mind when we just see this patient?
I was just wondering, has she had her blood sugars tested? She's got this thirst going on, and also there's a thing called dawn phenomenon that when you go to bed, if your blood levels are a certain level, and then when you wake up in the morning they're higher, that can cause headaches as well.
Thank you, Amanda.
Okay, yeah, I don't think she's had her blood sugar level tested. No.
Right. Any other comments from anybody else?
Is she a thin or fat lady? How
she's not thin. She is medium build. She's broad, and she was thin until she had her third child.
Okay.
And she's tall.
Oh,
she's about maybe sorry. About 5'8". She's maybe about 5'8", 5'7", 5'8".
Okay.
So I mean, on the medium height.
Right. Okay. Let's walk through this together, shall we, ladies and gentlemen? We've got this lady here, tall, medium built, dark skin complexion. I'm guessing from Trinidad, she's not going to be blonde haired, blue eyed. That's fine. So what kind of constitution comes to mind just by looking at that? It doesn't mean it's a remedy, but things like this should be just jump in our mind as we go through cases. Anything come to mind for anybody?
Yeah, I see phosphorus.
Nice one. Thanks, Joseph.
Yeah.
Yeah, phosphorus. We're going to get a lot of that as a constitutional remedy with a lot of our Asian, African, Caribbean countries. We're going to see a lot of these people, tall, medium skin, dark complexion, etc. So phosphorus. Now that's just there. Now let's go down some of these. Any movement is painful. It doesn't mean it's a remedy. Worse for movement. Everyone should know what remedy that makes us think of straight away. Anybody want to throw it on the table? Pain, worse for movement. Keynote.
Bryonia.
Thank you. Right, brilliant. And when we know about clams and modalities, one of the remedies is better for heat, one is worse for heat. There's bryonia and there's rust tox. There's also ruta, but ruta is almost identical to rust tox, just acts on the smaller tendons. So just bear that in mind. It doesn't mean it's a remedy right now, but it might be if you just want to deal with the joint pain as it is. But which seems very closed in. Now that's another key thing. So we've got lots of suppression going on. This is just to be able to pick the case this way. And I don't know if it's part of the cultural upbringing, or she just all cried out, or she doesn't want to say anything. I don't know at this stage. But seeing closed in, if Belgium was online, she'd say, right, everybody needs to be unsuppressed. I can remember that from the last few years. So that's absolutely fine. So she's got no pain, leaves swollen. That will tell us something what's going on. What kind of miasm is active in her?
Syphilitic.
Syphilitic. Okay.
Psychotic.
Psychotic. Both correct. She could also be psychosyphilitic. And she's had this for the last 20 years. So when we look at the timeline, we'll see what's going on here. X-rays show the fluids are drying out. That tells us that she needs a bit of water. She's a bit of a dehydrated lady. So Soleil again might be thinking. This helps her brain just think that way. And Soleil might actually help this lady quite a lot, because if she's perspiring, I bet you she's losing a lot of minerals. And the minerals is exactly what we need for bones and hips: calcium, phosphorus, magnesium, selenium, zinc, etc. So she's going to be minerally depleted and she's going to be dehydrated. So without any kind of remedies at the moment, nutritionally, we need to give her some Himalayan salt and rehydrate this lady. She's got a lump in her neck, blah, 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 hurting inside, nagging pain. So this is stubbornness, failure to move. On the emotional pain chart, the knees swollen. This is energetically the failure to move forward. So we've got to find out what's happened in her life for the last 20 years that she doesn't want to move forward in it with. Because she's got headaches on the mornings. Then you said that she thinks a lot. She's restless at night. She can't get to sleep till 5 in the morning. Things like nux vomica and sulfur come to mind. Sulfur people can't sleep between the hours of 2 and 5. She's a hot person. She's perspiring. So even sulfur comes to mind. It may or may not be the remedy here. Then she thinks that she's mind is restless. Rus tox is quite restless mind as well. And Rus tox is joint movement. But Rus tox is better for movement, not worse for movement. So we've got the modality to help us think of a remedy and to disclude the remedy if it doesn't work. She's got pain in the rectum. I wonder what's pissing her off in life, right? Simple as that. Her mind is racing at night. Then there's another keynote here. Where did she go? She has to sleep with her head high. Now that's a very interesting point, that, and it's one of the keynotes for arsenicum. Arsenicum people are the people that have to sit propped up with a few pillows in their bed at night. Very interesting little side note to note with people. And they often are very thirsty, and yet they sip their water, and they like medium to hot water, if not burning. I've got friends who just have a hot black coffee straight out the kettle. Boom. I'm like, what the hell? Arsenicum through and through, and obviously adrenally depleted. So there are loads of little indications of remedies that jump up here if we were just remedy chasing. But it helps us to identify with certain keynotes of remedies. So when we go into our clinics and patients talk, we're like, aha, it could be that, it could be that. Because that enables us then to ask other questions to either qualify and reinforce that remedy or to discount it and disqualify it. So she sits up and is unable to sleep. Restless mind, overthinking mind, busy mind. She feels very hot, perspires a lot. Quite a few remedies for that. Sulfur comes to mind. She's very thirsty. And the thing about the ice was interesting, because does anyone know what kind of remedy likes to drink ice cold water?
Phosphorus.
There you go. So we've got a tall, dark person here, and we've got someone who likes ice. And often with phosphorus people, they drink really ice cold water, but then once it gets warm, they're like, ugh, I don't feel right, because it warms up. And yet if they're arsenicum, warm and heat is their friend. For phosphorus, it's the opposite. They're the two differentials between the two. Now she's also got burning pains, I think you said. So
her stomach.
In the stomach. So burning in the stomach, nux vomica, but arsenicum is also burning pains in the stomach, but so is phosphorus. So there's a couple of remedies, that the keynotes that just jump out and kind of narrows down the universe from 7,000 remedies to about 4 or 5 key ones that they might be needed. Let's go on to this atenolol. Atenolol is a beta blocker. You're absolutely right. It's used very, very commonly for blood pressure. But a lot of doctors give it to calm people down, to give it to people when they're depressed. They could take a beta blocker. It slows you down. It chills you out. And when the heart's racing, beta blockers, they're called chronotropic, I think, and ionotropic. Chrono is the pace of the heart rate, and ionotropic, one is the pace and one is the force. I can't remember for the top of it. So they prevent the heart beating as fast and beating as hard. If it's beating hard, the pressure goes hard. If it's beating too fast, the heart races, which is why in the olden days, in the 60s and 70s, if someone was stressed out, they'd give them a beta blocker on a very, very low dose every now and again, just to keep them calm. So that's what beta blockers do. But one of the side effects of beta blockers is nightmares, and they have cold extremities, cold hands and feet. Just to note, as a side, it doesn't mean to this patient, but if someone ever comes and says, oh, I've got Raynaud's syndrome, I've got cold hands and feet, and I'm always cold, and I can't sleep, and I have nightmares, first thing to ask them is, are you on any beta blockers? 9 times out of 10, they will be. The remedies sound good. She is close, so Natmiol comes to mind. Carcinosin comes to mind for people who are very, very suppressed. So that's without knowing anything about her timeline, just to warm up our brain. Any questions or comments on this slide before we go to the next one?
I was just looking at the waking up with a sensation of fullness.
Yeah.
And it does say sulfur under there as well. You mentioned about sulfur a little while ago, I think.
Yes. Sulfur people, I think sulfur keynote is they can't sleep between 2 to 5. I think nux vomica is simple, that they go to sleep when it's daybreak again, something like this. So they hit the burning stuff, and we've got the perspiring, which is a very sulfury thing, isn't it? So good point there, Deb. Anybody else for any questions on here?
Yes, Som, I have something that came up for me, and the remedy is Avena sativa. And the reason I came up with that is that Avena sativa would help calm an overactive sympathetic nervous system and put it into a more parasympathetic nervous system. It would also help calm down a very active mind.
Yes. Absolutely brilliant, Francesca. Avena sativa is a fantastic nerve tonic. It's basically the homeopathic name for oatmeal. And it's a great nerve relaxer, along with things like Tilia europa and passiflora. But yeah, you're absolutely right. So if she has got an overactive mind, but we don't know what's making her overactive, but brilliant. Thank you. Anybody else?
She is.
Oh, hi, Mariana.
Hello. She is past menopausal, and as a result of that, as a result of the change of the estrogen levels, the lining of her stomach and the gut is very, very thin. And the fiery burning feeling could come from the fact that anything that you need to take after menopause should be mashed, or she's eating nuts somewhere. I read that she cannot, there is some causing. I think she needs to go on a diet that is very much pureed, or even cucumbers needs to be grated so that it doesn't cause any burning feeling. So that's the only thing that's
okay. Brilliant, thank you. Now, nuts hurt her stomach is interesting, because is it the physical landing in the stomach like a bomb that hurts, or is it the inability to digest nuts, Azrina?
I'm not quite sure. She just said it. I didn't pursue that, but she did say it just hurts her stomach.
Okay.
But I want to say it's not able to digest, because that's what she's talked about. She said,
okay. I'm tending towards that thinking, Azrina, because like the case before with Azrina with Randiraj, if she's unable to digest fats, now that's a rubric. Food, fats, unable to digest. Things like pulsatilla will come up again, because then that means her gallbladder, the energy there with the anger, suppressed anger, which she's got because she gets angry and she keeps it inside, and she learns to deal with it. It says down here, doesn't she? Of course she gets angry.
Yes.
And sometimes, but generally works out in her head and forgets it. So if anger's not coming out, it's going inside. And where do we store our anger? Liver and gallbladder. What does the liver do? It produces bile. Where's the bile stored? In the gallbladder. And the gallbladder, like a little bladder, pumps it out into the stomach where we can digest our fats. The sodium, the hydrochloric acid we need helps us digest our proteins in our stomach and churns. And what are nuts? They're full of protein and full of fat. So she needs more water, Himalayan salt, to remineralize her, to add in all the minerals, so she's got a good acidic stomach. An acidic stomach, not in a bad way, but so she can digest her food and her fats properly, along with an adequate amount of bile. So we can look at some good herbal tinctures to stimulate the bile, if you don't want to give pulsatilla as a remedy, because it may not fit a symptom picture. So there's a lot we can do here on a very basic nutritional supplemental level with this lady, because she's quite depleted. Just on this first slide, we don't know what the causes are. We'll come to that in a moment. So that's really the key lesson for us all, is every time we get information is information. It's being able to pull it out and say, well, what are we looking at? What is the patient doing? What are they lacking? What do they need? As well as connecting with them on an emotional level. Claire, I think you had a comment that you were going to share.
Oh, it was just, isn't bryonia linked to the food sits like a brick in the stomach?
Yes.
And we've mentioned the bryonia earlier, hasn't we? About
any movement is painful.
pain worse for movement. Yeah, it was just that. I saw a link there.
And does anyone want to share if bryonia is worse for heat or better for heat? Look it up in the modalities. I did say a few days ago to have your MAP meds nearby to you. So somebody's going to chirp in with that in a few seconds. Because you've got bryonia.
Hi, Sam. I think it says worse for heat. They're hot people, worse for heat. Yeah.
And this is where we got here, because she gets aggravated by hot weather.
Yeah.
And bryonia people are quite angry people. Bryonia is your bear with a sore head. In my language, piss off and leave me alone. So that's bryonia. They're quite angry. They get annoyed easily. They want to be left alone. Don't talk to me. You ask them a question, they get angry. The fact that you even asked them how they're doing. That's bryonia through and through. So
can I just add something? As you talk about being annoyed, there are a lot of mosquitoes, but she reacts like she needs to spray herself with repellent. She gets really uneasy. You can see her like just kept moving and a bit anxious about it. So it nags her. It really nags her.
Restless in her chair.
Very restless in her chair. Just the mosquitoes affect her a lot, and I think I noticed that about her. I felt that stood out to me.
See, they're the good observational skills. Well done, because then it tells you mind restless. Also, it could be mind annoyed easily. But they're the questions you can ask us. There's nothing wrong with us. When we observe a patient, we say, "Oh look, I noticed you're shifting around a lot." It could be that the chair's crap. It could be because of the weather. It could be because the back is sweating. It could be because the mosquitoes. You just say, "Isn't the mosquitoes?" Let them tell you what it is. And in our physical clinics, we often say, we have one person taking the case and the other person just observing like a hawk. Things that sometimes we miss out. But actually, when we run our own practices, we need to be able to do both things at the same time. And we always say, watch our patient, they will show us who they are. Because if she was arsenicum, she wouldn't sit still, but she wouldn't even be sitting. She'd be walking around the room, pacing up and down, telling you exactly what her problem is. But this person seems a bit more controlled than that, but easily irritated.
But she can't sit down like during the day. She has to be doing something.
Restless.
She can't sleep at all during the day. She moves, she's in her garden. She has to do something, if not wash, cook, something. She can't sit still at all.
That's quite arsenicum. And then you say she bent over and hurt her knee. There's a remedy for gardener's knee and housemaid's knee. I'm sure someone's going to shout that remedy. That's quite a very simple, basic remedy.
Sepia, isn't it? Yeah.
Housemaid's knee.
Is it that one?
Sepia? Any others? Arnica, Bellis perennis. These are the people with the aches and pains from doing physical work. Okay, thanks for that. Shall we go on to your second slide, Azrina?
Yes.
Okay, let's get some more context around it. Fire away.
So I know this person pretty well. So I know a lot of things about her that she didn't tell me. So I had to be unbiased. So I just put down here what she actually told me. So she can't remember too much about her life, about nothing to her. Her exact statement was, "Oh, I was young. I can't remember that at that time." So between 0 and 10, she can't remember. But at 11.
To be fair, just before you dive into this timeline, then, to be fair to all of us, if we know something about a patient, there is nothing to stop you putting it in. Because sometimes we often ask other people about them. If I've got a husband and wife and one doesn't want to talk, often the husband and his wife will do all the talking for him. If we have a parent who tells us about the child. So it's absolutely okay. Sometimes we have family members pull in our picture for us and complete the picture, especially when we know people. So if you do know that, there's nothing wrong with putting it in to complete your picture.
Okay, perfect.
As long as it's knowing a behavior or an event rather than an opinion. You can't say, well, she feels like this, because then we're speaking for them. But if you say she's experienced this, her husband died, we can write that down, then ask her later, how did it impact you? She might say, great, I hated him, couldn't wait for him to die. I don't know. But so we've got to be aware of our unconscious bias and our interpretation of what they say. But that's fine. Okay.
Well, I know that between from birth to when she got married and she left home at 18, there was a lot of abuse in her house, physical and emotional, and I'm sure verbal as well, but a lot of very physical abuse is really bad from her mother.
From her mother to her? From
her mother to her, yeah. Now, she always felt, she was the darkest. We're all East Indians, but she was darker than all her siblings. So she always felt that it was because of her complexion. But when I speak to her other siblings, they were treated the same way. But she was beaten. I mean, for the slightest thing, she was beaten. And I mean, as a little child, she had a lot of responsibility to cooking
Okay.
and right.
So just on that one line, because again, we're going to go through it, but even that, if we can stop them and say, what's happened to this child? What remedies jump out at us straight away?
Sagria.
Yes.
Staphysagria.
Thank you, Joseph. Thank you, Mariana. Staphysagria, ailment from abuse, domination, humiliation, along with carcinosin. Carcinosin is also the same. They're both rated as 4, but carcinosin also suppressed emotions. You're worthless. So if I'm worthless, it's not even worth me speaking, is it really? And if I'm taught to feel that way as a young girl, what the hell? Sorry, that's just at age 11. Poor child.
That's actually before age. That's from very early on to up until she left home.
Okay.
Even at their house too, they were never allowed. They lived next to a playground, and they were never allowed to go out there and interact with other children. And so they were always at home and always had responsibilities. So she was more like inside the house doing chores, cooking, but always inside. So she's not open to life. She was never really exposed to anything fun or otherwise.
Yeah.
She was also sexually abused by her brother, her older brother, during that time. But I think they were.
Oh my God! In the young years.
In her young years, he was 3 years older than her, but that same brother committed suicide when he was 14 and she was 11.
How did that suicide affect her?
She didn't say, like, for years she hid it, but it was revealed to us by someone else, and she hid it from her children for years and years. So I want to believe that there was a lot of fear that it happened to her, that her children did it. Her children followed suit and committed suicide as well. But she never ever talks about it. But she did. I asked her in the interview. She said her brother died at 11. I said, how did he die? And she said suicide. But that was no emotion. But she's so closed in. She doesn't show anything. Yeah, she's just numb.
I think, you know what, you could almost prescribe right here, right now, just on that alone. No need to even discuss anything else. We will for completion. Why would I make a statement as bold as that just to say that in the 2 lines? Let's just open it to everybody else.
Is it opium as well, Som, because of the numbness and the closedness?
We also got to bear in mind, ladies and gentlemen, Azrina has no materia medica, no repertory, no vision software. Her deliveries didn't arrive in lockdown. She's stuck there in Trinidad doing this all from just the lessons and listening into the clinics, etc. at the moment, right? So let's throw some. Why would we just say that she can be treated like this, and what remedies would they be? Because based on, let's assume that she's not going to get the book right now. You've got to be able to sometimes see these things and say, well, actually, I know what this patient needs.
Opium.
Opium. What else?
Carcinosin.
Yep. Good. Thank you. What else? Opium, napmio, carcinosin, and staphysagria.
I will say the stuff, for the sexual abuse.
Correct. This is it, and that's pretty much it. Because if we look back at our first chart, what is the cause of these symptoms? It goes right back to here, doesn't it? She's 62 years old. She's carried it for half a century. Cause, effects, obstacles to cure. This is affecting her body, the self-worth, right from such a young age. And as we say, sometimes the mind isn't in shock, but the body still is. And that's exactly what's happened to her here. She's carried this trauma through her, and it's manifesting in all these different ways. Because we also say when people have burning stomach, we said, it's not what you cannot eat, it's what's eating you inside. And maybe it's all this from the past. And it's actually so much so, it's been beaten out of her that she's not allowed to express herself. And then somebody that she knows and trusts and loves comes and abuses her, she's feeling worthless. She doesn't exist, she has no identity. She's just a piece of meat. But right, let's go beyond 11. Let's get to the happy day where she got married. I'm hoping it was happy for her.
Well, I mean, she got married at 18. She had her first child at 19. Well, she had asthma attacks. So that also, for me, stood out because it came on sometime between 11 and 13.
I think that would probably be panic attacks, what they'd describe as asthma.
Okay, all right.
Because when she relived the experiences, that would cause panic in her body, wouldn't it?
That's why I thought it was important. It stood out to me. So she got married really early. I mean, 18 is very young. She had her first child, like within 10 months, she had her first child. She was 19 by then.
Okay.
Via C-section. The baby, they said the baby was breached, so they had to do a C-section.
Okay.
She got pregnant pretty early. According what they said is she got pregnant quite too early after the first C-section, so the cut did not heal properly. So she had to have emergency C-section.
For the second?
For the second child, yeah. Now the third child came 6 years after the second, and they wanted to just take whatever necessary precautions and just go ahead and do a C-section.
Okay.
At 39, her mother died.
How did that impact her?
Again, she's numb. It didn't really. I know she took care of her mother in her dying days. Her mother had kidney failure, and in her dying days, she took care of her. She took time off from work and she stayed with her 24/7.
Okay.
But emotionally, I don't know because she's numb again. She doesn't show any emotion about it.
Okay, it's more of a duty of care because it's a mother rather than I love you, mom. Okay.
Yeah, and I think at that stage, like nobody was really taking the responsibility, and the mother was an overweight woman, a very heavy woman.
Okay.
But not really over. I want to say it was more swollen. She was more swollen than fat.
Okay.
But anyway, she was very heavy, and no one wanted to take the responsibility. And she said, "It's my mother. I will do it."
Yeah.
And it turned out that the mother eventually just only wanted her.
Yeah.
So she would only eat from her. She would only, she would only smile with her. But anyway, so at 39, her mother died. Now at 43, her first child, died from a vehicular accident. He was 24. 2 years later, she found all these lumps in her breast.
No surprise.
But they were surgically.
Yep.
Yeah. And around that time, she was having problems with her other son as well. He was very rebellious. He was abusive. He left home. He got married. He didn't invite her. He didn't include her. He had his first child, and that was a lot of problems. And he never had her involved in his life. So the lumps in the breast were surgically removed, but they said it was benign. Now, she found this small lump in her neck at that time, but she only told the doctors after the fact. And they said to her, well, you should have told me earlier, I would have removed it one time. At 54, her father died. And then she went into menopause around this year, sometime between 54 and 55. Now, at 59, she had a hysterectomy. Now, there's some history to this. She said after the birth of her third child, she continued spotting for a few years, and then she went to a doctor and he gave her some meds, which stopped it. And then she stopped the medication and the spotting came back after. And then for about 10 years, so that's about 10 years until she was, so that's maybe when she was about 49, the spotting continued. When she was 59, she went to the gynecologist, and the spotting was a red flag for them, one, and her uterus lining was thickening. And they were saying that this is not supposed to happen after menopause, so she should do a hysterectomy because it could lead to cancer.
Okay, let's just stop there for a second. The reason I'm stopping because there's so many important things right here. She got married, she was beaten up and abused. We know that Nux, Cark, Staph aureus, Natmure, and opium are right there. We know that off the bat, right? All these things point to that. Had a first child died in vehicle accident. Everyone's from grief. We get in that. And I think Francesca mentioned earlier, lacumanum also helps in great ways of this. There's a lot of estrangement from family, not quite connecting with the family, not quite having the love she deserved. The heart chakra. Lacumanum, very, very important here as well. So is rose quartz. She found lumps in her breast. Now, these are not cancerous. So what she's in here is a tubercular state. Because a tubercular state is the body hardening itself against life that life has been hard to us. So it hardens itself to protect itself. And I always say that, tubercular people are tall, dark-skinned. She's tall, dark-skinned. She's a tubercular constitution. Phosphorus is a tubercular remedy. On the first slide, we talked about phosphorus and we had a bit of a laugh about the ice. And we talked about the arsenicum sitting up. Arsenicum is quite tubercular. It's also a syphilitic remedy. So we see the active miasm in her right now is a tubercular miasm. and the doctors are right, and we can see it. If it's not dealt with, it's going to turn to cancer, which is the next miasm through, isn't it? So we can see which miasmatic state she's in. We can see which one she's headed to already just by these 3 or 4 little lines on her timeline here. That's why I just wanted to stop this, Asreen, and this is what's becoming so apparent as we're just looking at the case. Okay. And she went into menopause. Now we have we have a high blood pressure case. So some of the students that have already got that far in their cases about parents died, went into menopause, blah, blah, blah. It's a similar story here. So it's looking at the cause rather than treating the menopause. Yes, she's at the age anyway. She had the hysterectomy. She said the uterus lining was thickening. Again, look what's happened to her internally. She was abused internally before she became a mother down there. And now even that, her hormones are hardening against herself. We know physiologically it's due to excess of hormone and excess of tissue buildup. But what's her body telling her? It has no use for kids now because the menopause is gone. So it's going to harden itself. It's going to protect itself because that's another inlet into her body. So at an energetic level, she's very, very tubercular to protect herself now. That's just, I'm just saying, that's just jumping out the page at me here while you're getting into it. Sorry, just to dive in because I felt it needed to be said.
I'm good. No problem.
Okay, far away.
Well, I mean, that's it for her timeline. Now, her family history. Now, her dad had gout, arthritis, and he also had stomach problems. So a lot of pain, a lot of gas. He eventually developed diabetes, like in his old age, maybe after 70 years, he developed diabetes, but he eventually died from a heart attack at age 82.
What miasm is that going on with her father?
Is it syphilitic?
Yeah, it's all destructive there.
Yeah.
Okay.
Her mother always, for years and years before her death, she had kidney issues. She had one kidney removed and the other was barely functioning. And she, just before she died, she started to swell and started to just, like her feet were cracking up, and she died eventually from kidney failure, I guess, but she just only got like one or two what's the treatment? Dialysis.
Dialysis, yeah.
And then she died.
Okay.
Her brothers, two of her brothers have heart issues. One had a minor heart attack over lockdown. Two of them have gout, and one has diabetes. And her sister, well, she's the eldest daughter, but her sisters, her younger sisters, one has asthma, one has thyroid problems.
Okay.
I think it's hypoactive thyroid.
Yeah.
Her aunts on her father's side, one died from a heart attack, a few of them had arthritis, and 2 had knee replacement surgery.
Okay.
And her uncle, he had degeneration of muscles. So he was paralyzed he was paralyzed for a few years before he died. On her grandmother's side, on her mother's side, her grandmother had thyroid issues, and she eventually died from that. I think she had either the thyroid completely removed or had partially removed, and she was on a replacement drug. She eventually died.
Yeah.
Her grandfather died from a heart attack. She has aunts with cancer and diabetes on the mother's side, and she has uncle with diabetes, cancer, and kidney stones on the mother's side.
We're seeing very strong miasmatic tendencies here, aren't we?
Yeah.
If you look down the whole timeline, the whole family issues, which miasm just jumps out the page at you?
Cancer and syphilitic with a lot of heart issues.
Yeah, heart attack, diabetes, heart attack, kidney, they're all syphilitic, self-destruction, destruction, knee replacement, the body's attacking itself. So that's the picture. Any comments on this page before we go? I think there's another page coming up.
Yep, so I got a comment with regards to the family history and the sisters with thyroid issues and the grandmother with thyroid issues. I agree with Azrina that it's quite likely it was hypothyroidism. That means it was underactive.
Yep.
When I was looking at Azrina's patient's case, I also got alarm bells going off saying this lady maybe has a thyroid issue.
Yep.
That raised alarms for me. I know I'm in the UK. Azrina, I believe, is in Trinidad.
Yep.
Yes.
That in the UK, the test for the functioning of an underactive thyroid is, in my humble opinion, inadequate. It only tests for TSH, I think it is, and T4, doesn't for T3.
Correct.
If I also know that in my own country that a lot of ladies, when they go into the menopause, their doctors will tell them that they have a thyroid issue and will put them on thyroid medication. That, I believe, happens and coincides with the menopause because the menopause creates a fluctuation in hormones. So I suspect this patient might have an undiagnosed thyroid issue that may need support. If she is malnourished and unable to take in nutrients, my thought is that the lady needs what we would call super greens, like I can't pronounce it.
Chlorella, spirulina.
Spirulina, selenium. Moringa, absolutely, moringa. And I'm sure in Trinidad there will be natural vegetation that would also supply the same nutrients nutritionally.
I think
comment.
Good. I think you're right because with the issue with her neck, she's actually in the clinic right now, and they did a number of tests for thyroid, and they've ruled out thyroid.
Well,
so I think you're right. The test is probably not accurate. It's not
Yeah, what she might have a form. There's different types of thyroid. She might have something called goiter, which can cause the swelling in the neck. And Francesca's bang on there. We have the hypothalamus releases something called TSH, thyroid stimulating hormone. It goes to the thyroid and gets it to stimulate its own hormone. And there's different components. There's T4, which they test for. But the actual thing that makes thyroxine is T3. T3 stands for triiodothyronine, which is then converted to thyroxine. The clues in the name, triiodo, it creates 3 iodine molecules to fit onto the thyrionine to make thyroxine. So therefore you're thinking, gosh, this person might be iodine deficient. So iodine type supergreens, kelp, bladderwrack, ashwagandha, these things nourish the body naturally with iodine, but then so does Himalayan salt. Here in the UK, they have this horrible salt called table salt. It's white, it's bleached. And then they give it back and they call it iodized salt. Well, don't take the iodine in the first place and it'd be fine. Just call it salt. So natural salt, rock salt, sea salt, Himalayan salt has the right balance of iodine. Iodine is such a minor trace element. The body needs very, very, very little of it, but that can be enough to rebalance the body back. That slows up the metabolism. It affects the mineral absorption with the adrenal glands. So something as little as a trace element could be the key here. So this could be a nutritional mineral depletion issue here with this patient. And yes, we know we've got a lot of depression going on and suppression and napmure, and we talk about napmure aurum, etc. But we've also got some stuff that we can help her with nutritionally. So that helps just for knowing this alone here. Unlike Randiraj's case, where she got all the nutrition right, the patient just couldn't absorb it. Here, hopefully the patient can absorb it if she's provided the right nutrition and the glands are stimulated. So there's a lot we can do with her right now. I think there's one more slide. But before we go, for any other questions or observations from anybody here or comments?
I've got one.
Hi, Randiraj.
Yeah, I'm just looking at the gout. The gout, and you just talked about goiter, but the bryonia has a really close affiliation to gout, and that, so if it's in the lineage and the kind of hierarchy of the family, it's something worth thinking about.
Yeah, brilliant. Thank you. Azrina, shall we move on?
Yes.
Okay.
So
I took out your rubrics because I thought we'd all help together here. But let's and as you can see that we're coming together to a prescription already, aren't we? Just in the slides.
Yeah. So it's just that in terms of analyzing the case, you know, I could tell, as we talked about, she's numb, she's closed in, she's not in touch with her emotions. There's a lot of trauma in her life, both emotional and physical, because she had a number of surgeries. She had 3 C-sections. She had this surgery for the benign lump. She had a hysterectomy. There's a lot of trauma, 2 types of trauma, emotional, physical. Well, I mean, we touched on everything, the emotions, the trauma, losing her son, something she never dealt with. Even talking to even if you mention his name, she would just bow her head and just get quiet. She just wouldn't say a thing. Go ahead.
No, go on.
And the only thing, like in terms of cause effects, I think the trauma are her causes, are the causes of her problems.
Yeah.
And you know, because she's suppressing everything, everything is manifesting physically now.
Yeah. So if you look at this patient, there's no obstacle. She's only on a bit of a Tenolol every now and again, right? Other than that, she's actually okay. For a 62-year-old lady, there's not many toxins going into her, is there?
No, she's never taken a lot of medication, no birth control, nothing. All her life.
And I'm sure Joseph will add to this. Now, you know, he just had 5-6 months with Ellen there doing the clinics that he's holding up there in Ghana. When you got people with good constitutions, you can look at them straight and say, well, what could it be? And this is a very straight cut case, the way we're looking at it. So my comment would be here, if we use the classical method, 4 or 5 mental emotions, 2 or 3 physical gens, 1 physical particular. And then add to that, we've got the element from shock and bad news that are closing her in. And again, you know, I always say to everybody, fall in love with arnica because it's trauma in all its forms, not just the bruises. I think someone's trying to make a comment there. No? Okay. Okay, so you okay with that? Shall we go to the rubric slide that we put together?
Yeah.
Yep. So this is just based on this, ladies and gentlemen. Obviously, please feel free to challenge me on this and say, well, actually, Som, we can try a different method. There's never an absolute right way or wrong way. There's just one method that we can apply. But why do we use the classical method? When the symptoms are quite clear, when we know the cause and effects, we just take the standard approach. Simple as that. So what we're going to do, we take the classical. We've got the 4 or 5 emotionals here. Bad news ailments from, number 1 thing, strong emotions, suppressed emotions. Now, isn't that interesting? That's a rubric that not a lot of people use, but it's there. What I didn't know here that I've learned from today with reading the course is she was sexually abused, etc. So we could have put in here ailments from domination, abuse, etc. We should have rated carcinosin and Staphylococcus aureus much higher. That much we know. But even there with ailments from sorrow, we've got carcinosin over here. We've got ignatia, we've got Staphylococcus aureus, we've got natmule. All the remedies we talked about. The only one that's not too high here is opium at the moment. But opium, you don't really need to repertoire. The minute someone says numb, my mind automatically goes to opium. They're high, they're numb, they're blocked off. That's quite an easy one. And so we've got the physical generals, general sweating, and a couple of particulars. It gives us to our leading remedies. And natmule, what is it? It's salt. Common salt. We're just saying she needs Himalayan salt. Himalayan Soleil will give her the natmule she needs, along with the iodine and everything else, and the calcium and the phosphorus and the magnesium. Because that's what Himalayan salt is. It's got all the minerals in one, and it will rehydrate her because she's a bit dry and she's thirsty. And when you've got salt in your body, it sucks in by osmosis other water molecules anyway, so it will rehydrate her body. So we know that energetically she needs natmule, physiologically she needs natmule. And giving it in Himalayan Soleil will give her all the minerals that she's depleted on, all the trace minerals. Does that make sense?
Yeah.
So the remedies that we talked about a few moments ago, natmule,
Bryonia,
Staphylococcus aureus, carcinosin, they're definitely the right prescription for this lady, and opium. And whatever remedy, whatever potency you say you have there, use. That's absolutely fine. I think you said you're on 1M. You're doing the right thing. You said it worked and it stopped working for a bit. She's burning because she doesn't have enough hydrochloric acid in her stomach anyway. She can make more, she'll be fine. And that's what the Himalayan Soleil will help. You say that you put her on this and she was fine. She's been feeling that for 20, 30, 40, 50 years. So it's going to take more than just one remedy, 1 month to work. See? So keep her on it and it will start getting her better and better and better. Add to that the nutritional support and you've got your prescription. Pretty simple.
So I could give her kelp. I could give her ashwagandha.
So much, yes.
I
Bladderwrack.
have I have super green grass superfoods. I could give her that.
Yes.
What about the magnesium, magnesium citrate?
Perfect. If that's what she's got, magnesium citrate, give her that. She's going to need that. She's over 60 anyway. That will definitely help her.
Okay, so the remedies will be continue with Natmio, continue with Ignatia, continue with Nox.
Yeah.
But should I? Go ahead.
Go on, no, go on.
Should I add Staphysagria?
Yes,
And,
definitely. Because the one rubric we haven't got there is ailments from domination and abuse, and ailments from rape or sexual abuse, and this is where Staphysagria and carcinosin are absolutely key. So I say this to many, so I've actually got a Nux, Carc, Natmio, Staphysagria mix at 30C. I keep it just as ready-made because so many patients need that anyway. It doesn't matter on the potency for whatever you can obtain where you are, but these are the remedies that she needs. Nux, Carc, Natmio, Staphysagria, opium.
Oh, opium, but yeah, I wouldn't be able to get a mix. I'll just have to get them individually.
However you get them, yeah, just get them to pop them in the mouth at the same time. Does the same job.
Oh, okay.
She does not have to take one after another. There's no this golden rule, wait 2 minutes to dance around a tree. Just put them in the mouth, they'll work.
Okay.
Well, that's what we do. When we combine it, we just put the energy into one pill, don't we? So it's the same thing.
And you said any potency, but if I get like a 1M, that's fine as well?
Yeah. Often when you've had a chronic, the case notes will tell you that when you're dealing on the classical method, even Ellen's book will, and it'll say anything from 30C to 1M, right? Normal prescriptions. So any potency you can get will work because you go low and slow because you're trying to unravel something from way back. The intercurrent I would add in, she's got this element from shock. Now, when you're in shock, the shock of her son dying will have hit her hard. It will hit her heart hard. But it also affects her adrenal glands, which is where the mineral depletion comes in. And when you're shocked that way, you deplete your magnesium. Your magnesium goes up, your carb goes too high, your calcium goes high, and you start hardening on the inside. If your body's using all that up, there isn't enough calc carb to make your joints properly, which combines with phosphorus to make calc phos. So we know nutritionally she's been mineral depleted from the shock she's had. So that's where the adrenal support is. And ashwagandha is an adaptogenic herb for the adrenal glands and the thyroid gland. So you've got it there. You added some sea kelp or bladderwrack, you've got your iodine. You add in some magnesium, which is needed. It's so important in the body, especially with ailments from shock and grief. So she's so undernourished in magnesium, it's unreal. And it's unfortunate she can't digest nuts because my go-to for magnesium is a handful of almonds every day.
Yeah, and it's almond she can't digest.
Yeah. So then we have to give it either, what am I thinking? Nutritionally, supplementally, if she can absorb the magnesium citrate. And citrate is one of the best bioavailable forms in powder form, unless she wants to go to ionic magnesium and mix it with the water. So that would
That's
work.
all right. That's all right too. Okay, I have that as well.
Failing that, you could just give a mag-phos as a remedy. But you can try the supplemental approach first, because then patients like to feel like they're getting something physically inside them, not just a remedy as well.
Right.
If you can get hold of the 12 tissue salts, that would help her. But again, she's 62, and because she has to take 4 or 5 remedies singularly, not as a combo, I probably wouldn't overburden her too much. The Soleil will do the job so much. And if you doubt that, I suppose you can have, I'm sure, Joseph, we're looking forward to the days when you're going to tell us about your experiences at clinic and the wonders of Soleil and dealing with the waxy ear with the thyroid and all sorts of things. You know, so Joseph, you want to share some thoughts on how wonderful Soleil is? Quite simple with people there at the clinics.
Yes. Where do I start? Yeah, it's very helpful. I mean, when Ellen was here, it was one of the common prescriptions to majority of the patients, and most of our patients came in with hypertension and diabetes. And they always said they felt better a few days after beginning to use the Soleil. But I think I'll give you more information when I do the presentation.
Brilliant.
Yeah.
Thank you for sharing that, Joseph. For us, ladies and gentlemen around the world, Joseph's in Ghana. He's a medical doctor there as well as a homeopath there. And he was doing the clinics with Ellen in Ghana, the Ghana outreach clinics there. And again, people with good constitutions there. Same with Trinidad. Not too many complications, drug layers. So quite simply, there's a mineral imbalance more often than not. Even our hormones have minerals attached to them. Our chemicals, our neurotransmitters, they're all minerals. So very often it comes down to minerals. And we'll be doing a webinar on this in a few weeks' time. I just need to get the slides together. And Himalayan Soul covers your bases quite easily, nutritionally, and it's simple to have in the countries that you're in. And it literally will work wonders. So that's quite a simple case in that respect, Asrina. And the beauty of the carcinosin, because you're giving a Nux, Natmio, Ignatia, and Nux. So that's helping to deal with the grief. Has Nat Muir silent grief. That's another keynote of Nat Muir. She's got that. But you want to unsuppress her a little bit so she can open up to herself, not just to you. She may not even open up to you ever, but she'll feel better within herself because all this suppressed feelings and emotions are causing her ailments. The burning, the can't digest life, the can't move forward, the aches and pains in the joints, the swelling in the knee, and I don't want to move forward. This is all that. The carcinosin and Sapphiris agria will help to lift that. The opium will stop her being so closed and numb to the world. Well, she'll be in touch with herself. And hopefully for the next 10, 20 years, however long she's got left, she can enjoy life a bit more. So that's where these remedies in combination will work wonders for her. So adding them will definitely add to it. Don't worry about that. I had it this month and it came back a week ago. But tell her to be patient. She's had this for 50 years since she was 12 years old. So going after 4 or 5 weeks, it's going to take a bit of time, but she's going to get there. And once she starts on that path, then the recovery will be rapid. But we've got to kind of jumpstart and get her going first. Okay?
Okay.
Any questions or comments and observations from anybody else about this case or any of the others?
Yes, Som, I think we should pay attention to the thyroid. Because I'm seeing here that, during the course of the management, just keep an eye on that thyroid, because I'm seeing here that she feels very hot.
Yes.
And perspires a lot. These are two important symptoms in hyperthyroidism.
Yes.
And then she also has the racing heart whilst at rest.
Yes.
And she finds it difficult to sleep. These are also two common symptoms in an overactive thyroid.
Yes.
Yeah.
So this was
it's interesting that, sorry, Som, it's interesting that during the repertorization, Nat Muir comes up because, Nat Muir is one of the leading remedies for thyroid disorders.
Yes.
Yeah. Just
absolutely.
Observations.
Brilliant. Brilliant.
Thank you.
I think Ellen mentioned something that you're on about. I think you're on about an enzyme. Was it between calcium and phosphorus or calc-phos or something? She said Joseph went and did some work on an enzyme somewhere, and she couldn't remember what it was.
Yeah, I'll have to look through my notes again. I think it's got to do with calc-phos.
Calc-phos.
The relationship between phosphorus and what's the other? The relationship between phosphorus and alkaline phosphatase.
Okay.
Alkaline phosphatase is an enzyme produced by the liver.
Yep.
And I think we were discussing how liver pathology can have an impact on certain enzymes and minerals.
Yes.
And why then phosphorus becomes such an important mineral or remedy, I think, in liver disorders.
Yes.
So I was trying to I was trying to work it out myself, just in my own mind.
Yeah.
Why phosphorus would be necessary in certain liver conditions.
No,
it's a bit complicated. So I need to make a write-up and then present it properly.
Now that's brilliant, actually, because when we looked at here, we know that phosphorus is a major liver remedy, right? We looked at it in the case earlier about the liver cancer.
Yes.
And alkaline phosphatase, ALP, and then we've got ALT, alkaline transferase. These are a couple of the liver remedies that are in blood test all the time, aren't they? They measure the level.
Yes. Yes.
And it's alkaline phosphatase. So it's an enzyme that breaks down phosphoric acid to stop it being acidic.
Right.
So when alkaline phosphatase levels are raised too high, it tells us that we are in a destructive acidic phase.
Yes.
And the liver leaches out more ALP. It's elevated because it tells us the body is trying to stop this phosphoric acid destructive phase in us and restore us back to phosphorus, because phosphate is a base. Phosphoric acid is an acid, isn't it? Acid alkaline.
Yes.
So
Yes.
alkaline phosphatase takes the acid and alkalizes it. And so when that level enzyme is too high, it means our body is too acidic. It's trying to alkalize it. Isn't that interesting?
It is.
So that's why phosphorus is a very important remedy for us in our overall being, for being good, for being happy, for being energetic, but also good for our bones and our liver and our sensitivities and our lungs, because it's a tubercular remedy too. It's also great for liver cancer. And this person is a phosphorus tuberculous, a very tubercular remedy, tall, dark-skinned, broad-shouldered people. So it's quite interesting that the remedy works. And what does phosphorus do? Causes destructive metabolism. So no wonder that alkaline phosphatase is a very important enzyme for us, and that's how the allopaths measure it. What do? We just give phosphorus, calc-phos, or whatever, and it's quite easy. And if they really get too acidic, we give phosphoric acid back, like cures like. And I think we started off this clinic talking about phosphorus and phosphoric acid, I think, right at the start. when we said about someone who's had the life sucked out of them, it's the acidic version of the phosphorus. And the first case was someone who's lively, available. Sharon's mother, I think, was, has got nothing left to live for. So that joy has been taken out of them. So we can see how the links are with these remedies, energetically, but also physiologically within the body, biochemically. So yeah, no, I remember Ellen telling me about that. She goes, "You've got to talk to Joseph about the enzymes." So we look forward to your tales from your clinics over there.
Right.
Are very useful.
Coming soon.
Yes. So they're very, very important about the thyroid and that meal. Thank you for that. Any other questions or comments from anybody else?
Can I just clarify one thing? All the remedies, the Natmio, the Nox, the Ignitia, the Saphosagria, the Casanosin, and the opium, should you take all like one at once?
Yeah, why not?
Okay. And any time of the day is fine?
Yeah, because if we were going to give them as a combo remedy, all the frequencies will be in one pill, wouldn't they?
Okay.
So just get them, if she doesn't want the 4 or 5 pills rolling around in the mouth, then she can just take her time. Put 2 in at a time.
Okay, all right.
Depends on the size of the pills or tablets you have there, you see.
Yeah.
Or you might say,
Okay.
take these 2 in the morning and these 2 at night. Just, check, depending on her compliance. You say you know her well, see what's going to suit her best. Some people look at them and say, "Oh my gosh, I'm not taking 5 in one go." Then don't. Then take 2 in the morning, 1 at night, and 2 at night, and whatever. Work it out.
Okay, all right.
Whatever she's going to comply with, and then do a follow up with her in another month, and let's hope that we can present her again at next month's clinic, and see what changes there are. And you might just find she might not have any physical changes, but she might just say, "You know what? I feel better in myself." She might even be a bit more talkative and less closed. Because your first observation was tall, medium, very closed in, no eye contact. She doesn't want you to look inside her soul because she doesn't like what's inside there. Too much hurt, too much grief, too much abuse, too much loss.
Yeah.
And she needs to come to terms with that.
Absolutely.
Okay.
Can I just
Right.
make one last observation very quickly in terms of the abuse and also the thyroid for that matter, is the issue of humiliation. But not only just that, but that anybody who has been abused often reports how they themselves feel guilt, as if they had invited it. They feel dirty. They feel unclean. They feel that they must be a bad person. This isn't true, it's what they are thinking. And that would tie in with the self-destruction, the destructive miasm.
What a brilliant insight there, Francesca, because it ties in with opium as well, and ailments from guilt and shame. Even though they haven't done anything wrong, they're made to feel. It's how they're made to feel. And yeah, brilliant. And I remember, my little songs. I remember opium. I didn't say, "Oh my, as in, oh my, I've done something wrong," and I kind of withdraw into myself. Like the little child who's ate all the sweets and tells his mum he's didn't put his hand in the cookie jar, so to speak. So you're absolutely right. And they're the rubrics that we didn't put in because until we heard from Azrina, we didn't know the full story here. So that guilt feeling, the shame feeling, the abuse, Staphylococcus aureus kind of rises to the top with carcinosin more than all the other remedies right now. Because once they unsuppress, they tend to feel better in themselves. So a very nice, good way to end on a classical case, but in good constitution countries, we should see a lot of classical, which is why classical homeopathy works everywhere else except for with modern patients. So it's just a nice example of that, and to go back to treating the organs. Hope that's okay.
That's really good.
Right. Any questions from anybody else?
I've got one.
Hi, Randiraj. Yep.
Hi. I'm just noticing on the case again, there's the hemorrhoids. She's waking up at night, very painful. She's in a lot of, and she's got a lot of pain there. So I think we need to do something on the liver support.
Well, that would be trouble letting go of her emotions, isn't it? On an energetic level.
Okay.
You see, so and that's what we're saying, because we're going to work for the cause rather than the effects, and that's what the classical thing helps us: cause, effects, obstacles to cure. Once you treat that, that will go. Natmure and Nux vomica are fantastic for things like that. If we have different types of hemorrhoids, you've got things like Acelus, Conker, the Conker tree is great for hemorrhoids as well. But we also have things like Nitak, which are great. That's for more like splinter-like pains, like knives or sticks stuck in there. So there's lots that we can look at that way. But I think that is an end result of what this lady's going through, I think, at the moment. And her body's trying to release these negative emotions. It's burning up, it's got the hemorrhoids, it's trying to get rid of them. So the remedies will help her release them and the body will rectify itself.
Okay, thank
So
you.
the symptoms are the signs of the body saying, look, I need to focus on something deeper, on a more mental emotional level, and it's helping us find it and tie it in that way. That's it's a very good point there. Any more for any more?
It's Claire. I was just saying it would be really useful to have a webinar on the thyroid as well, if that's possible in the future.
Yeah.
Okay, on all 3 or 4 different things: Hashimoto's, goiter, hyper, and hypo. Yeah, and we can even cover the remedies like thyroidinum, iodatum, etc.
Yeah, that would be
Iodatum,
wonderful.
kali
Thank you.
iode. Okay, well that's something worth considering. We're going to do the minerals webinar soon, because the minerals are a lot, and the minerals come before vitamins. And for those of you who don't know, vitamins don't act in the absence of minerals. So minerals come first, vitamins come after. And that's why a lot of people say, take a multivitamin. The first thing is, no, take your minerals, which is where the Soleil comes in. And then in that environment, the vitamins can do their job, not the other way around. So yeah, we'll do them first, and then we'll get onto the thyroid. I've also got a webinar I want to do on male pattern balding and ladies' hair loss and balding as well. Quite interesting. So, but okay, let's wrap it up. Thank you very much. Sorry, Asrina.
Can I just ask one quick question before we go?
Sure.
Is there anything she needs to cut out from her diet? So like coffee, tea, oats.
Is she taking coffee?
She drinks coffee once a day, every day.
Once a day is fine. If you're doing 4 or 5 cups, then that means her adrenals are very suppressed. Now, remember, if you're going to give her ashwagandha, it's an adaptogenic herb. So if the adrenals or thyroid are overproducing, it's going to regulate them down. If they're underproducing, it's going to nudge them upwards. A wonderful, wonderful herb, ashwagandha.
So she take 2 or 3 capsules a day?
She take 1 capsule twice a day with food.
Okay.
And that's Withania somnifera. It's between 350 to 500 milligrams, depending on where you get your herbs from. Given that twice a day, it tends to do the job quite nicely. But this doesn't work all at once. Because it's a herb, it'll take time, it'll take a couple of months. But then the body works naturally. It takes 3 months to detox the liver. So we're not expecting a miracle in 1 week. She's going to be flying high as a kite. No. Every couple of months, she'll just feel better. And her body will regulate. That, along with the Soleil, along with the Napmio, it will balance out her thyroid quite nicely.
Okay.
Okay. Perfect.
All right. Thanks very much.
Well, ladies and gentlemen, thank you very much. Let's keep them on a regular basis monthly. Get your patients in. Let's keep the clinics active. We learn so much from them. And thank you all for making it a great success.
Thank you, Som. Have a good week.
Thanks, Som.
Thank you very much.
Bye-bye, everyone.
Bye.
Bye-bye.
Bye.
Bye.